The handcuffs weren't real, but the humiliation was. Trauma nurse Mara Solis stood in the middle of Crestline General's main corridor while two security guards flanked her like she was a criminal. Her badge had been cut from her lanyard. Her locker had been emptied into a cardboard box, someone shoved into her hands without a word. Around her, the hospital kept moving. Monitors beeping, gurneys rolling, staff stepping aside to watch. And not one person said anything in her defense. Dr. Preston Hale stood 15 feet away with his arms crossed, watching with the particular satisfaction of a man who had just won something he didn't deserve. He had accused her of reckless endangerment. The board had believed him in under 40 minutes, and now Mara Solis, the best trauma nurse in this hospital, was being walked out like a threat. If this story has you gripped already, follow this channel right now, hit like, and drop a comment with the city you're watching from. I want to see how far this story travels. Now let's go. The morning had started the way most bad days do, quietly and without warning. Mara arrived at Crestline General Hospital in Denton, Colorado at 6:43, 17 minutes before her shift officially began. She took the east stairwell instead of the elevator because the elevator in that wing ran slow, and she had never been able to tolerate standing still when there was somewhere she needed to be. She changed in the locker room, pulled her dark hair back with a rubber band she kept on her wrist, clipped her ID to her scrub top, and walked onto the trauma floor already reading through the overnight board before she reached the station. 3 patients from a highway accident, 2 of them still waiting on imaging. 1 post-op cardiac case transferred up from the ICU at 3 in the morning, flagged for close monitoring. A 17-year-old with a suspected spinal injury being held carefully in Bay 4, pending neurology consult. She did a round before her first official patient contact, something she had done for 11 years without being asked. Not because the protocol required it, because she needed to know where everything stood before the day started moving, and there was no longer time to look. The charge nurse, Diane Forsyth, was finishing her overnight handoff at the station when Mara came back through. "You're early again," Diane said without looking up from the binder she was annotating. "Board looked heavy." "It always looks heavy on Tuesdays." Diane glanced at her briefly. "Hale's running the floor today." Mara didn't respond to that. She pulled up the first highway accident patient's chart on the terminal. Diane set her pen down. "You two doing okay?" "We're professional," Mara said, which was not the same thing as okay, and they both knew it, but Diane had been in hospital nursing long enough not to push past the answer someone chose to give. Dr. Preston Hale was Crestline General's chief resident, a title he wore the way certain men wear expensive watches, visibly and for the benefit of other people. He had finished his residency in the top third of his program, had excellent instincts in certain areas of emergency medicine, and was deeply committed to a model of hospital hierarchy in which nurses existed to execute physician orders cleanly and without editorial comment. He and Mara had disagreed twice in the past 8 months, once in March, once in July. Both times, the clinical record had sided with her afterward. Neither time had he acknowledged it. She went to work. The highway accident patients were stable but banged up. A middle-aged couple and a delivery driver who had come off second best against a guardrail at highway speed. She rechecked all 3 charts from overnight, caught a dosing discrepancy on the woman's anticoagulant order that hadn't been flagged, and corrected it through the covering attending before it had a chance to become a problem. The post-op cardiac case was recovering on schedule, vitals holding, no signs of the complications the overnight team had been watching for. The teenager in Bay 4, his name was Marcus, 17, a cross-country runner who had slipped on a trail and come down wrong on a steep slope, was awake and trying not to look as scared as he was. Mara stopped in Bay 4 for 4 minutes before she had to move on. She answered his questions honestly, which was not always what patients wanted, but was almost always what they needed. "Is my back going to be okay?" he asked. "We don't know yet. That's the straight answer. We're waiting on neurology to review your imaging, and until they do, we're keeping you still and keeping you monitored. That's the right call right now." He looked at the ceiling for a moment, processing. "What are the chances it's bad?" "I can't give you a number that means anything at this point. What I can tell you is that the way you're presenting, the sensation you still have, the way your pain is localized, those are not the worst signs." He nodded, working something through. "Your parents are in the waiting room," she added. I'll have someone tell them they can come back in about 10 minutes. He exhaled slowly. Yeah. Okay. A pause. Thanks for not lying to me. That's not really my style, she said, and moved on. By 8:15, the floor had found its rhythm. That particular hum of a trauma unit in mid-morning, busy but not overwhelmed, the kind of functional chaos that experienced staff navigated without thinking about it. Mara was managing 4 patients across 3 bays and tracking 2 more on the board when Bay 7 came up for assignment. Gerald Musk, 53 years old, arrived by private vehicle at 7:50 with chest pain diaphoresis and what his wife described as a sudden onset of pain that had started between his shoulder blades and moved toward his chest. Intake troponin was borderline elevated. EKG had been run and read as non-specific. Mara read through his intake notes twice at the station before she went in. There was something about the pattern that sat wrong. She went in and introduced herself and asked him to walk her through the pain in his own words. Not the version he'd already given intake, his own words right now. It started in my back, Gerald said. He was a large, solid man who looked like someone accustomed to physical work, and he was pale in a way that didn't match his build. Like someone, I don't know, like someone drove something between my shoulder blades. I thought I pulled something. Then it moved. He pressed a hand flat against the center of his chest. Down here. And it's not constant. It comes and goes. Does the pain move anywhere else? Down your arm into your jaw? No, just back to chest. Back to chest. She checked his pressure manually. It had dropped 4 points from the intake reading 40 minutes ago. She pulled up his chart on the Bay tablet and looked at the EKG strip again. The nonspecific read was technically defensible, but there was a subtle widening in the mediastinal silhouette on his chest X-ray that had been captured on intake. Not dramatic, not the kind of thing that jumped out at you if you were moving fast, but present if you were looking for it. She was looking for it. She found Dr. Yolanda Priest in the corridor near the nursing station, a careful, methodical attending who had been at Crestline General for 9 years and had the reputation of someone who listened when she needed to. Bay 7, Mara said. Gerald Musk. I want to flag something. Priest stopped. Go ahead. His pain pattern is back to chest migrating, not the classic arm and jaw presentation. His pressure has dropped since intake, and it's not positional. I just took a manual, and it's down another 4. His EKG read nonspecific, but there's a subtle finding I want you to look at, and his CXR has a mediastinal shadow that I think warrants a second look. Priest was quiet for a moment. You're thinking dissection. I think we should rule it out before we treat this as a straightforward cardiac event. Priest didn't argue. She didn't do that thing some physicians did where they needed a moment to absorb the fact that the clinical flag had come from a nurse. She said, order a repeat troponin and I'll look at the strip. If I agree, we'll get CT angio. Thank you. That was at 8:22. At 8:49, Gerald Musk's monitor alarm fired. Mara was 6 feet from Bay 7 when it happened. She didn't wait to hear what the alarm code was. She knew from the sound pattern, and she was already moving, pushing through the curtain before the second alarm cycle completed. Gerald was drenched in sweat. His color had gone from pale to the kind of gray that means the body is making choices about where to send its remaining resources, and it is not choosing the extremities. His eyes found her, and there was something in them beyond pain, a specific quality of fear that the body produces when it knows something is wrong before the conscious mind has caught up. Something's happening, he said. His voice was thin. Something is really happening. I know. She had his wrist already, feeling his pulse, thready, fast, irregular in the wrong way. I need you to look at me. Right here. I've got you. She hit the call button. Bay 7, this is Solis. I need crash cart and attending now. Patient is hemodynamically compromised. I need vascular surgery paged immediately. Do not, I repeat, do not initiate cardiac protocol without attending assessment. This presentation is not consistent with primary cardiac event. Dr. Priest was through the curtain in under 90 seconds. Preston Hale arrived 10 seconds after that. He had heard the overhead from wherever he'd been and had come to run the emergency, the way he always came to run emergencies, moving fast and arriving with his authority already assembled around him like a coat he'd put on in the hallway. He looked at the monitor. He looked at Gerald. He read the pressure number on the screen. "Defib ready," he said. "He's going to VFib." "His rhythm is sinus," Mara said. Hale's eyes moved to her, not quickly, with the slow, deliberate quality of someone choosing how to respond. "I'm sorry?" "He's not fibrillating. His rhythm is sinus tach with pressure drop. This is not a primary arrhythmia. His aorta is tearing. Defibrillation will kill him." The bay had gone very still. There were 4 other staff members present now. A second nurse, a tech, the crash cart team, and every one of them had stopped moving. Hale took a single step toward the defibrillator. Mara moved. She didn't lunge. She didn't make a scene of it. She simply stepped between Hale and the crash cart with the flat, practiced efficiency of someone who had placed herself between a threat and a patient before, in conditions where the word threat meant something considerably more concrete than a physician disagreement. She looked at him directly. "Do not shock this patient." The silence lasted 3 seconds. Hale's jaw worked once. Dr. Priest said, "Hold." She moved to the monitor, looked at the strip, looked at Gerald, and then looked at Mara. "Give me the clinical picture, fast." Mara gave it in 20 seconds. The pain migration, the pressure trend, the mediastinal shadow on CXR, the troponin pattern, the absence of arm radiation, the presence of back-to-chest movement. She had memorized every data point in that chart because she had known something was wrong since before she had clinical language to attach to it. And she had been building the case in her mind for the past half hour. When she finished, the bay was completely quiet except for the monitor. Priest said, "Get me CT angio, now, and Page vascular." Hale said, "You're taking her word over E." "Preston." Priest's voice was not loud, but it had a quality that stopped him. "Page vascular, and get out of my way." Whoa. Gerald Musk went to CT at 9:17. Mara stood at the nursing station while the scan processed and tried to do the normal things, update her other charts, check on Marcus in Bay 4, refill the saline bags that had run low in 2 of the highway accident bays. She did all of it. Her hands did not shake. Her voice, when she spoke to patients and colleagues, was exactly what it always was. Inside, she was very, very still, in the way she had learned to be still when she was waiting on information that was going to matter. The scan came back at 9:53. Type A aortic dissection. The tear was in the ascending aorta, beginning just above the valve, extending toward the arch. It was significant. It had been progressing. Dr. Anita Reyes, the vascular surgeon who had responded to the page, looked at the imaging for 45 seconds without speaking. Then she said, "OR now. He's not stable enough to wait." And then quietly, more to herself than the room, "If we'd shocked him." She didn't finish the sentence. She didn't need to. Gerald Musk was in the OR by 10:15 ASAM. Mara was at the charting terminal documenting the handoff when Preston Hale appeared behind her. She had known he would come. She had known it since the moment in the bay when she had stepped in front of him, and she had felt his stillness change quality. Stop being the stillness of a man trying to assess a situation and become the stillness of a man cataloging an offense. "We need to talk," he said. She finished the line she was typing, then she saved the entry. Then she turned around. "Okay," she said. They were in a relatively quiet section of the corridor, but not private. 2 nurses were charting at the far end of the station. A tech was moving supplies across the hallway. Hale was aware of that. He kept his voice low in the way that people keep their voices low when they want the words to land harder, not softer. "You contradicted a physician's clinical assessment in front of staff and a patient," he said. "I provided clinical input during a critical situation. That's within my professional scope. You blocked a treatment order. I communicated a safety concern to the attending physician. Dr. Priest made the clinical decision. You stepped in front of me." His voice dropped further. "You physically placed yourself between me and the equipment, in front of the team, in front of a dying patient." Mara met his eyes. She had a quality that sometimes unnerved people who were trying to intimidate her. Not aggression, not defiance exactly, but a complete absence of the reflexive flinch that most people produced in this kind of moment. She had had that quality removed from her somewhere around the 2nd year of a life she had lived before this one, and it had never quite come back. "I was doing my job," she said. "Your job," Hale said, "is to follow physician orders. That is the structure of this institution. That is the structure of medicine." My job is patient safety. Those are not always the same thing. He stared at her. Gerald Musk is alive, she said. That's the outcome. The outcome, Hale said slowly, is that you embarrassed a senior physician in front of his team and violated the chain of command that this hospital depends on. He held her gaze for one more moment. And we'll see what the board has to say about that. He walked away. She turned back to her terminal. The entry she had been writing was still on the screen. She read back the last 3 lines to make sure they accurately reflected what had happened, made one small correction, and saved it. Her hands were completely steady. The call to the administrative wing came at 10:22. Martin Gould's office was on the 3rd floor, separated from the clinical floors by a carpeted corridor and a different quality of silence. The silence of institutional process rather than medical emergency, which was, in its own way, more oppressive. Gould himself was the kind of administrator who had been in hospital management long enough to have learned the particular skill of delivering bad news in language that sounded reasonable from every angle. He sat across from Mara with his hands folded and a printed document on the desk in front of him. Next to him, a woman from HR named Susan Keene had a tablet open and was not quite making eye contact. "We appreciate you coming up," Gould said. Mara sat down and waited. "We've received a formal complaint from Dr. Hale regarding the incident in Bay 7 this morning." He glanced at the document. "The complaint characterizes your behavior as a pattern of insubordination." He references a March incident and a July incident and describes today's events as a reckless disregard for protocol that created risk for the patient and undermined physician authority. Mara said, "The patient is alive because of what I did. That's something the review process will—" "I want to understand something." Her voice was even. "A patient arrived with an aortic dissection that was being misread as a cardiac event. I identified the misread, communicated it to the attending, and the attending agreed and acted on it. The patient went to the OR and survived. That is what happened this morning. I would like to understand which part of that constitutes a safety risk." Gould shifted in his chair. It was a small movement, barely visible, but she had been reading small movements in high-pressure situations for a long time. "The complaint also alleges," Keene said, stepping in with the careful neutrality of someone managing a process, "that you physically obstructed a physician from accessing medical equipment. I communicated clearly that I believed a specific intervention would harm the patient. I was in a position between a physician and a piece of equipment for approximately 3 seconds while waiting for the attending to make a call. The attending made the call." "Dr. Hale describes it differently," Gould said. "I'm sure he does." The room was quiet for a moment. "We've decided," Gould said carefully, "to place you on administrative suspension, effective immediately, pending a formal review of the complaint and a full investigation." Mara looked at him. "The suspension is paid," Keene added, "and the review process will be—" "How long?" Mara said. "Typically these processes take—" "How long?" Gould said, "Several weeks. Possibly longer, given the nature of the allegations." Mara was quiet for a moment. She looked at the document on the desk. It was printed on hospital letterhead and had Hale's name at the top and a list of incidents that she recognized but would not have recognized if she had been reading them cold. They were accurate in the narrow factual sense and deeply inaccurate in every way that mattered. "I need you to surrender your badge to security," Keene said, "and collect your personal belongings." Mara stood up. She did not say what she was thinking, which was that a patient had nearly died this morning because of Preston Hale's misread, and that the hospital was now suspending the person who had caught it, and that the document on the desk described a version of events that had been carefully constructed to make that fact disappear. She said nothing, because there was nothing to say that would matter to these people right now. The machinery was moving. It had been moving since before this meeting started, probably since before Hale filed his complaint, probably since some conversation she hadn't been in and wouldn't hear about. She knew how this worked. She went downstairs. She emptied her locker, stethoscope, a spare pair of trauma shears, a clinical reference binder she had annotated over 3 years, a tube of hand lotion, the photograph she kept tucked inside the front cover of a patient chart folder, a mug with her name written on a piece of medical tape because the new staff kept taking the wrong cups from the break room. She put it all in the cardboard box. She handed her badge to the security officer at the desk. A man named Roy, who had worked the desk for 4 years and who could not meet her eyes. And then the two guards walked her out. The corridor felt different from this direction. She had walked it thousands of times. She knew the distance from the nursing station to the exit by feel, by the number of doorways, by the particular squeak of the floor near Bay 11 that facilities had been meaning to fix for 2 years. She had walked it after difficult shifts and easy ones, after patients died and after patients made it when they shouldn't have, after 12-hour days that had left her so tired she was driving home on muscle memory alone. She had never walked it like this. Around her, the hospital moved. Monitors beeped. A gurney rolled past, pushed by a tech she recognized. Somewhere behind her, a physician's voice cut through the ambient sound, giving orders in the flat, rapid cadence of someone managing an emergency. She heard people talking as she passed the nursing station. Not quietly enough. Hale's filing formal papers. Insubordination, endangering patients. I always thought she had a chip on her shoulder. She thought she knew more than the doctors. Always. Mara kept walking. She passed Bay 7. The curtain was closed. Gerald Musk was in the OR. His wife, Margaret, was in the surgical waiting area on the second floor, sitting alone with a paper cup of coffee she probably wasn't drinking, waiting for someone to come tell her whether her husband was going to be okay. Mara had not had a chance to tell Margaret anything before this happened. She kept walking. Preston Hale was near the exit, not directly in her path, positioned slightly to the side, in the particular way of someone who wanted to be present without being obvious about it. She saw him before he expected her to. She always saw things before people expected her to. He didn't speak. She didn't look at him. The exit doors opened and the Colorado morning came in. October cold, clean, the particular high-altitude brightness that made Denton's sky look slightly more blue than it had any right to. She walked to her truck. She put the box in the passenger seat. She sat behind the wheel. 30 seconds. She gave herself 30 seconds to just sit there, because she was human, and this was humiliating, and the body sometimes needed a moment, even when the mind had already moved on to the next thing. Then she started the engine. She was 3.5 blocks from Crestline General, stopped at a red light when the phone vibrated. Not her personal phone. Her other one. The one with the matte black case and no manufacturer markings, and a different SIM and a different number. The one she kept in the interior pocket of her jacket because it was too important to leave anywhere. It could be accidentally forgotten or mixed up with other things. The one she had not heard make a sound in 2 years and 4 months. The light was red. She pulled it out and looked at the screen. 4 lines. No header. No greeting. The format was precise in a way she recognized from a context that had nothing to do with hospitals or administration or Preston Hale. Solis. Mara A. A. Authorization active. Priority medical asset. Status elevated standby for contact do not power down device. She read it twice. The light changed. She didn't move. Behind her, a car waited, then tapped its horn gently, once. She pulled forward and turned right onto the next street and pulled over in front of a dry cleaner that wasn't open yet. She sat with the phone in her hand and looked at the message. She understood what the format meant. She understood what the authorization language meant. She understood the category of situation that generated a message like this, because there were not many categories, and she had been present for several of them. The truck idled. She put her personal phone in the cup holder and held the other one in both hands and waited. She did not have to wait long. 8 minutes after the message, the phone rang. She answered on the second ring. Solis. The voice was one she knew, not a voice she associated with comfort exactly, but with a very specific kind of reliability, the kind that exists between people who have been in situations where reliability was the only currency that mattered. Commander, this is Vasquez, Lima team, out of Fort Reardon. I know who you are. Yes, ma'am. A brief pause in which she could hear background noise, aircraft noise, the particular kind that came from inside a moving helicopter. I'm sorry for the unscheduled contact. We're running out of options and time. Tell me. Colonel Darnell Reyes. He was extracted from a forward location approximately 8 hours ago with a gunshot wound to the right thoracic cavity and secondary blast exposure. He's been in the air since extraction. We've had 2 near arrests in flight. His pressure is unstable and our flight medic has done everything she can, but we're beyond what we can manage in the air. A pause. The injury profile is vascular. Shrapnel displacement from the blast complicated the gunshot wound. He needs an OR, and he needs a specific kind of surgical capacity that... Where are you landing? That's the issue, Commander. We're 41 minutes out from Crestline General in Denton. It's the closest facility with the OR capacity for this kind of trauma. But when we contacted the hospital to advise of our approach and request that you be standing by... Another pause, shorter. They told us you were unavailable. Mara was very still. The colonel has been asking for you specifically, Vasquez continued. He's been intermittently conscious. He was... A brief hesitation, the hesitation of someone relaying something that doesn't fit neatly into a situation report. He was fairly insistent. He has my personal contact number. He tried it, ma'am. There was no answer. A pause. We ran a secondary trace on your alternate contact protocol. That's what generated the authorization message. She understood. Her personal phone had been in her locker when she was called upstairs. She had turned it to silent for the meeting and hadn't turned it back. It had been in a box being carried through a hospital corridor while a man she had served with for 3 years was in the air bleeding. What's his current status? She said. Pressure is cycling between 80 and 100 systolic. He's on pressors. He's been conscious for about 12 minutes out of the last 40. When he's conscious, he's... Vasquez paused. He's functional, ma'am. He's not delirious. He knows where he is and what's happening. He keeps asking for you. Mara looked through the windshield. The dry cleaner's sign said open at 8. It was nearly 11. A woman in a yellow coat walked past on the sidewalk, talking on her phone, not looking at anything in particular. Vasquez, she said, I need to tell you something. Ma'am, I am currently on administrative suspension from Crestline General, as of approximately 40 minutes ago. She let that sit for 1 second. If you land on that helipad and request my presence, there will be a conflict. A pause. Commander, Vasquez said, and his voice had changed in a way she recognized. The change that happened when someone in a chain of command recalibrated the nature of a situation. With respect. Are you telling me you won't be there, or are you telling me there might be a problem when you arrive? She almost smiled. I'm telling you there might be a problem when I arrive, she said. Understood. Another pause. We have documentation, authorization codes. The colonel's file is classified, but there are components that can be disclosed to civilian medical leadership if required. It may be required. Yes, ma'am. We're prepared for that. She was already putting the truck in drive. 41 minutes, she said. 40 now. Tell Colonel Reyes he's going to be fine. He'll want to know you said that personally. Then he can tell me himself when he's out of the OR, she said. I'm coming. She ended the call. She put the phone on the passenger seat next to the cardboard box. She made a U-turn at the next intersection and drove back the way she had come. And she drove fast, not reckless but fast, the way she drove when time was a clinical variable and not just an abstraction. The box shifted on the seat when she took the corner. She didn't look at it. In her mind, she was already somewhere else. Back in a framework she hadn't inhabited in 2 years, running through vascular trauma management in the specific context of blast plus penetrating injury, thinking about what Gerald Musk's OR team might be encountering 3 floors above her and what Colonel Reyes's OR team was going to need in 40 minutes, thinking about pressors and blood products and the particular challenges of a thoracic vascular wound that had been managed in flight for 8 hours. She was thinking also about Preston Hale standing near the exit watching her leave, and about the fact that she was going back. Crestline General came into view ahead. The sky above it was clear and October cold and very blue, and into that sky, still invisible, still beyond the horizon, something was coming fast. And into that sky, still invisible, still beyond the horizon, something was coming fast. She pulled into the hospital parking lot at 10:58 and sat in her truck for exactly 4 seconds deciding how to do this. There was a version of this where she went through the front entrance and asked to speak to Gould and tried to explain the situation in the language of institutional process. There was another version where she went directly to the ER and let the situation explain itself when it arrived. She chose the second version, not because it was easier, it wasn't, but because she had 40 minutes, now 37, and institutional process moved at its own pace regardless of what was happening in the air above Colorado. She got out of the truck. She left the cardboard box on the passenger seat. She walked toward the ER entrance, not the main lobby, because the ER entrance was where the helipad stairs came down, and because she knew that building the way she knew her own hands. Roy was still at the security desk inside the ER entrance. He looked up when she came through the doors, and his expression went through three things in rapid succession: recognition, confusion, and then a particular kind of discomfort that belonged to people caught between two competing authorities. "Ms. Solis, I need to speak to whoever is running the trauma floor right now," she said. "It's not about my suspension. There's an inbound military medical emergency, and I need to brief the team before they land. You're not supposed to be—" "Roy." She stopped at the desk and looked at him directly, not unkindly. "I understand the position you're in. I'm not asking you to make a call about my employment status. I'm telling you that in approximately 36 minutes, a military helicopter is going to land on that helipad with a critically wounded officer, and the people in this building need to know it's coming. Call Gould if you need to. Call whoever you need to call. But don't waste the next 10 minutes doing nothing." Roy picked up his desk phone. She moved past him toward the trauma bay. The floor was running at normal mid-morning volume, busy but not overwhelmed. The same rhythm she had left 40 minutes ago, except that her name was no longer on the board, and her patients had been redistributed to other staff. She saw Diane Forsyth at the nursing station, and Diane saw her, and Diane's face did a complicated thing. "Mara, you can't be here." "I know. I need 2 minutes." She lowered her voice. "There's an inbound military medevac. ETA approximately 35 minutes to the helipad. Vascular trauma, thoracic, blast plus penetrating injury. Patient has been in flight for 8+ hours. He's been managed on pressors and is pressure cycling. He's going to need an OR immediately on arrival, and Dr. Reyes should be on standby." Diane stared at her. "How do you know this?" she said. "Because they called me. Because the patient requested me specifically." Mara glanced toward the corridor where Hale's voice could be heard somewhere out of sight. "I'm not trying to create a problem. I'm trying to make sure this hospital is ready for what's coming. What you do with that information is up to you." Diane was quiet for a moment. She had been in nursing for 22 years, and she had the instincts that came from that. The ability to assess a situation not just by its surface, but by its weight, by what it cost the person delivering it. "How serious?" she said. "Serious enough that they broke a 2-year communications blackout to find me." Diane looked at her for one more second. Then she picked up the phone on the desk. Mara moved toward the corridor near the helipad access stairwell and took up a position near the wall, out of the main traffic flow, and waited. She could hear Diane on the phone behind her. Not the words, just the tone of someone relaying information they believed and wanted other people to take seriously. She checked the tactical phone. 33 minutes. Preston Hale appeared at the end of the corridor. He had been told she was back, clearly, because he was moving with purpose, and his expression had the quality of someone who had already composed what he was going to say. He stopped 6 feet from her. "You need to leave," he said. "You are on administrative suspension. You are not authorized to be in this facility." "I'm aware of my status." "Then you understand I can have security remove you." "There is a military medevac inbound to this helipad," Mara said. 32 minutes. "I'd suggest the more pressing issue is whether this facility is prepared to receive a vascular trauma patient who has been critical for 8 hours in flight." Hale's expression shifted. Not much. He was good at keeping his face controlled. But enough. "What are you talking about?" "Contact from the transport team came through me because the patient specifically requested my involvement. I'm not here to argue about this morning. I'm here because a man is going to be on that helipad in 32 minutes, and he may not survive the next hour if the right team isn't ready." Hale stared at her. "Who is the patient?" he said. "A military officer. The details are classified at a level above what I can share in a hallway." "You're telling me you have classified information." "I'm telling you a helicopter is coming and someone should call Dr. Reyes." Something moved behind Hale's eyes. She could see him calculating, the competing weight of his anger at her presence against the possibility that she was telling the truth and the professional consequences of ignoring a legitimate medical emergency. "I'll verify this with administration," he said. "Do that, but do it fast." He walked away. She turned back to the helipad door and waited. The next 28 minutes were the particular kind of difficult that doesn't look difficult from the outside. She stood near the stairwell. People passed her. Nurses, techs, a transport aide with a wheelchair. And some of them looked at her, and some of them didn't. And she held the same posture through all of it, still, grounded, waiting. She checked the phone twice more. She ran the clinical scenario in her head for the fourth time, adjusting for variables she didn't have data on yet. The exact location of the shrapnel, the specific pressure pattern, whether the 8 hours in flight had allowed any secondary injury to develop. Martin Gould appeared at 11:17. He came down the corridor with Susan Keene behind him, and the particular expression of someone who had been interrupted doing something else and was not happy about it. Ms. Solis. He stopped at a distance that was professionally cordial and personally cold. You were told to leave the premises. I heard you. I need 5 minutes. You're in violation of your suspension. Mr. Gould. She turned to face him fully. In approximately 18 minutes, a military helicopter is going to land on the roof of this building carrying a critically wounded officer who is under classified military orders and whose transport team contacted me directly because he requested my involvement. I do not have the authority to stop that helicopter from landing here. What I can do is make sure your staff is ready for what comes off it. A pause. You can deal with my suspension afterward. Right now I need you to make sure Dr. Reyes is scrubbed and the OR is prepped for thoracic vascular trauma. Gould looked at her for a long moment. He was not a stupid man. That was the thing about administrators who survived in their roles. They were rarely stupid. They were just optimized for a different set of priorities than the people who worked the clinical floors. Can you verify this? He said. She handed him the tactical phone with the authorization message visible on the screen. He looked at it. His expression changed. What is this format? He said. Military Authorization Protocol. If you want to verify it independently, there's a DoD medical liaison number you can call. It will take about 12 minutes to get through the right channels. She took the phone back. Or you can start prepping the OR. Gould looked at Keene. Something passed between them that was not quite a conversation. Then Gould said, Get Dr. Reyes. At 11:31, Mara heard it. Not saw, heard first. The particular sound of military rotors was distinct from civilian helicopter traffic in a way she had learned to identify years before she ever worked in a hospital, in a context that had nothing to do with medicine. The frequency was different, the pattern was different, the sense of mass and speed and intentionality was different. She was already at the helipad door when the first one came over the tree line. Through the reinforced glass panel, she watched the helicopter descend. Black, unmarked, except for identification numbers, moving with the efficiency of a crew that had done this 100 times and knew every second mattered. It touched down precisely, and the rotors were still spinning when the side door opened and operators in tactical gear began moving. Then the second helicopter came in low behind the first, slower, the medical transport. And the third, which she hadn't known about, swept wide and held in a holding pattern above the hospital, not landing, just present, which told her something about the level of this operation that she stored away and didn't comment on. She pushed through the helipad door and onto the roof. The cold hit her immediately. October at altitude, wind from the rotors adding to it, and she went into the wind without breaking stride because she had worked in worse cold than this in places where the cold was the least of what was trying to kill you. The medical transport had discharged its passengers, 2 operators and a flight medic who was already calling out the patient's current stats as they moved toward her, the words clipped and precise and in the vocabulary of field medicine rather than hospital medicine. Solis, the flight medic said. She was a young woman, short, with the look of someone who had been running on adrenaline and competence for several hours straight. Yes. Thank God. She said it without ceremony, not as a sentiment, but as a tactical response. He's been asking for you since we extracted. Pressure dropped twice more in the last 30 minutes. He's on max pressure dose, and I don't have anything left to give him. What's his GCS? 11 on last check, 12 minutes ago. He was oriented, gave us his name and location, tried to give me orders about his own treatment. A brief, strained, almost smile. He's a colonel. They don't really stop. No, Mara agreed. They don't. She looked at the gurney. Colonel Darnell Reyes was 51 years old and had the physical build of someone who had spent 30 of those years demanding things from his body that most people wouldn't ask of theirs. Right now he was pale under the oxygen mask, his right side wrapped in field dressings that had been changed multiple times based on the layering she could see, an IV line in each arm, a monitor clipped to his finger. His eyes were open. They found her immediately. She moved to the side of the gurney. "Commander." His voice was rough and quiet under the mask. Not weak. Roughness from effort, not from failure. "Colonel." She put 2 fingers on his wrist, not because she needed to when the monitor was right there, but because it was the first thing she always did, and because physical contact in this context carried information no monitor provided. His pulse was thready, but present. His skin was cold and damp. "You look terrible." Something moved in his eyes that might have been a smile if his face had more to give right now. "I've looked worse." "You have," she agreed. "I was there." She looked at the flight medic. "Last BP? 84/50, 8 minutes ago." "Blood products?" 2 units packed red cells in flight. That's all we had." She straightened and looked at the operators who were moving the gurney toward the rooftop door. "Let's go." But the descent from the helipad to the ER level was where things started to come apart. Not medically. Medically, she was managing. The elevator from the roof opened directly to a surgical prep corridor, and she had already identified which route would cut the most time, and the gurney was moving. But the doors at the base of the helipad stairwell opened into a hallway, and in that hallway, Preston Hale was standing with 2 hospital security officers and Martin Gould, and the expression on Hale's face told her that whatever calculation he had been running for the past 20 minutes had arrived at a specific conclusion. "Ms. Solis." Gould's voice was not unkind exactly, but it had the quality of someone reading from a document they had already decided to read from. "I've spoken with our legal team. Given your current suspension status, your direct involvement in patient care—" "Move," Mara said. Not loudly. She didn't need to be loud. The gurney was 2 feet behind her and the flight medic was on the other side of it, and 2 operators flanked it, and the whole assembly was moving and was not going to stop, and Gould registered this and took a small step to the side without quite deciding to. "I need to be clear about the liability. Mr. Gould." She did not stop moving. "This man is a decorated military officer under active medical authorization. His transport team has documentation that supersedes civilian institutional authority in emergency medical situations. If you want to discuss my employment status, I am available after he is in the OR." She kept walking. "Get out of the way." Hale said, "You cannot practice nursing in this facility." One of the operators, a large man with the flat, patient expression of someone who had been in many rooms where people were saying things that didn't matter, turned his head toward Hale and said nothing. Just looked at him. Hale stopped talking. The gurney kept moving. She heard Gould behind her, on his phone now, voice low and fast, talking to someone she couldn't identify. She heard Hale say something to one of the security officers. She did not turn around. Dr. Anita Reyes met them at the OR corridor junction. She had been briefed. Diane had gotten to her, or Gould had, or both. And she was already moving alongside the gurney, pulling on gloves, her eyes running the same rapid clinical assessment that Mara had run on the rooftop. "Talk to me," she said to Mara. Mara talked. She gave Reyes everything the flight medic had given her, plus her own assessment from the rooftop, plus the parameters she had been running in her head for the past 35 minutes. Blast plus penetrating, right thoracic, shrapnel displacement suspected near the subclavian, 8 hours of pressure cycling, max pressor dose, no additional blood products available in flight. Reyes listened the way good surgeons listened, completely, without interrupting, processing in parallel. "I need him in OR too," Reyes said to the scrub tech trailing them. "Get me vascular surgery on second call, and make sure the perfusionist is aware this may turn into bypass territory." She looked at Mara. "You're coming in?" "If you want me. I want you." Reyes said it without hesitation, the way clinicians said things when the clinical calculus was clear and the institutional complications were someone else's problem. "You know this patient, and you know this injury pattern better than anyone in this building." They pushed through the OR corridor door. Behind them, the hallway door swung closed. Behind that door, Preston Hale and Martin Gould and the administrative machinery of Crestline General Hospital were all doing whatever they were doing. In here, none of that existed. In here, there was a man on a table and a surgical team and a set of problems that had specific solutions if you were fast enough and good enough and didn't lose the thread. Mara scrubbed at the sink outside OR2 with the automatic efficiency of someone who had scrubbed in under worse conditions than this. She didn't let herself think about what she was doing. She just did it, each step in the sequence exactly where it had always been. Through the OR window, she could see Reyes already at the table, talking to her team. The scrub tech helped her gown and glove, and she pushed through the door. The next 74 minutes were not smooth. She would not have described them as smooth afterward, and if anyone had suggested they were, she would have corrected them, because the reality of what happened in OR2 between 11:47 and 1:01 was not smooth. It was hard and messy and had 3 distinct moments where the outcome balanced on something that felt thinner than it should have. The first problem emerged 6 minutes in. The shrapnel placement was worse than the imaging had suggested, not near the subclavian, but actually in contact with it. A fragment of irregular metal pressed against the vessel wall in a configuration that meant any significant pressure change could complete a tear that was currently being held closed by physics and luck. Reyes looked at the imaging the flight medic had brought and looked at what she was seeing in the chest cavity and said quietly, "That is not where I expected it." "No," Mara agreed. "Options?" Mara looked at the fragment. She had seen shrapnel injuries before, not in civilian ORS, but in places where the difference between the right call and the wrong one was not recorded in a hospital chart but in the names on a list nobody wanted to be on. If we try to remove it with his pressure where it is, the vessel movement during extraction might finish the tear. Agreed. So we stabilize first. And we need to be very quiet about how we do it. Reyes nodded once. She understood the language. Quiet meant slow, precise. No sudden movements, no unnecessary traction. She adjusted her approach, and her team adjusted with her, the whole room dropping into a different register, the particular careful stillness of surgeons doing something that required them to not move faster than the situation allowed. The second problem came at the 31-minute mark. Rhea's second call vascular surgeon, a man named Dr. Philip Carver, who was technically excellent and had worked with Reyes for 4 years, arrived in the OR and immediately had a different read on the fragment management. "We take it out now," he said, looking at the field. "Every minute it's in there is a minute the vessel wall is under stress. Every minute we try to remove it is a minute we risk completing the tear," Reyes said. "The stabilization approach is taking too long. His pressure is holding at 91, Mara said. She was on the monitoring side, tracking every number. "It's been stable for 11 minutes. The approach is working." Carver looked at her. He had not been briefed on who she was exactly, or if he had been briefed, he hadn't absorbed the full context. "Who are you?" he said. "I'm the person watching his numbers," Mara said. "And the numbers say hold." Carver looked at Reyes. Reyes said, "We hold." Carver made a sound that wasn't quite an argument and wasn't quite agreement, and moved to the other side of the table to assist in a way that made it clear he still thought he was right. He might have been right. She didn't know for certain, and she would never know for certain, and that was something she had made her peace with years ago. The fact that in medicine, as in certain other fields she had inhabited, you made the best call you could with the information you had, and you lived with it either way. They held. Reyes worked with the specific methodical patience that Mara had seen in maybe a dozen surgeons over her career. Not speed, but economy. No wasted movement, every gesture purposeful. At the 54-minute mark, the fragment came free. It came out clean as a piece of irregular metal embedded in tissue for 9 hours could come out. And the vessel wall held, and Reyes looked at it for 1 second in the extraction instrument and then handed it off without ceremony and kept working. The room exhaled collectively. Not loudly. These were people who had been in ORs long enough to know that exhaling too early was its own kind of mistake. But the pressure held. The vessel held. Reyes closed in layers, methodical, careful, the same quality of attention through the closing as through the hardest part. And at 1:01 in the afternoon, Colonel Darnell Reyes was moved to a surgical recovery bay with a chest tube, a repaired subclavian, 2 units of blood running, and a blood pressure of 106/68. Not perfect, not out of danger, but alive. and moving in the right direction. Mara stood at the scrub sink outside OR2 and ran cold water over her hands and stood there for a moment with her eyes closed. Not in relief, exactly. Relief implied that she had been afraid, and she hadn't been afraid. She had been focused, which was different, which was the thing that took over when fear would have cost too much. But the transition back from focus to something else took a moment, and she allowed herself that moment at the sink. Then she dried her hands and turned around. The corridor outside the OR was not empty. Martin Gould was there. Susan Keene was there. Preston Hale was there. 2 security officers she didn't recognize were positioned near the corridor junction in the way that people are positioned when someone has decided something is about to happen. And there were 3 other people she did not recognize. 2 men in civilian clothes and a woman in a Navy uniform with the insignia of a JAG officer, standing slightly apart from the hospital administration group in a way that communicated clearly that they were not part of the same team. The hallway was quiet. Gould said, "Ms. Solis, the patient has been stabilized. At this point, your involvement in this matter." "Mr. Gould." The JAG officer spoke. Her voice was practiced, precise, with the particular quality of someone who spoke in rooms where words had legal weight, and she knew it. "My name is Commander Patricia Weil, Judge Advocate General's Corps, Naval Medical Command. I've been attempting to reach your administrative office for the past 40 minutes. Gould blinked. Yes. Someone mentioned, I have documentation that I need you to review." She produced a folder, actual physical paper, which meant someone had anticipated this and prepared it in advance, which meant this was not improvised. "This covers the authorization status of Commander Solis in the context of this emergency, the classification parameters of the patient in your surgical recovery ward, and a formal military request that Commander Solis be granted immediate reinstatement of facility access for the duration of this officer's care." The word commander had now been used twice in this corridor. Mara watched Hale's face as the second usage landed. He had heard the first one. She had seen the small recalibration in his expression when Weil said it, the processing of a title that did not match the person he had filed a complaint against 4 hours ago. The second usage confirmed that it wasn't a mistake. "Commander," he said. The word came out flat, drained of its normal dismissiveness because he was still working through what it meant. Will handed the folder to Gould without looking at Hale. "The relevant authorization codes are on page 3. The patient's classification status is on page 4. Commander Solis's military credentials and commendations are summarized on pages 5 through 7, though the complete record remains classified." Gould opened the folder. He read. He was not a fast reader. He was a careful reader, which was usually an asset, but right now meant that everyone in the corridor was standing in silence, watching a hospital administrator read a government document. Keene read over his shoulder. Her expression went through something she tried not to show. Hale was still looking at Mara. She looked back, not with satisfaction, not with the particular expression of someone waiting to say "I told you so," because she had never been interested in that. It was expensive in energy, and it didn't change anything that mattered. She looked at him the way she had looked at him that morning, the same quality of still attention, but the context around that look was different now. "There's more," Weil said, and her voice carried a note of something that wasn't quite anticipation, but was pointed. "We've been made aware that Commander Solis was placed on administrative suspension this morning. We have also been provided with, through internal hospital reporting channels, a copy of the original complaint filed by Dr. Hale, the patient outcome data from this morning's emergency, and the documentation from the OR from this afternoon." Gould looked up from the folder. "The Naval Medical Command," Weil continued, "has a formal interest in the circumstances of Commander Solis's suspension, given that it directly affected our ability to reach her during a military medical emergency. We will be requesting a full review of the events of this morning." Gould said, That review would be an internal hospital matter. It would involve both internal hospital process and a federal inquiry into whether the suspension of a classified medical asset during an active emergency created a situation that endangered a military officer's life. Weil let that sit for exactly long enough. "We're not making accusations at this time. We're informing you that we're looking." The hallway was very quiet. One of the security officers shifted his weight slightly. Hale had gone still in a different way than his usual stillness. Not the controlled stillness of a man managing his presentation, but the specific stillness of a person who has just registered that the ground under them is different than they thought. He looked at the folder in Gould's hands. He looked at the JAG officer. He looked at Mara. She said nothing. She didn't need to. "Mr. Gould," Weil said, "I'll need a conference room and your administrative counsel's contact information. And I'll need Commander Solis's suspension to be formally paused pending the review." Gould closed the folder. His face had changed in the way that faces change when a person recalculates the weight of a decision they already made and finds it heavier than expected. "Yes," he said. "We can arrange that." Mara looked at him. "The review," she said quietly, "is going to find what it finds." Gould nodded once, the nod of a man who was no longer as certain as he had been 4 hours ago about which version of this morning's events he was going to be defending. Hale said nothing. Down the corridor, behind a set of double doors in a surgical recovery bay with monitors and an IV line and a chest tube, Colonel Darnell Reyes was breathing. That was the only thing that mattered right now. Everything else was still coming, but it was coming fast. Commander Patricia Weil took the conference room on the 3rd floor and spent the next 40 minutes in it, with the door closed and her phone pressed to her ear and the folder open on the table in front of her. Mara knew this because Diane Forsyth told her, and Diane knew because one of the administrative assistants whose desk was outside that conference room had been listening in the particular way that hospital staff listen when something unusual is happening. Not eavesdropping exactly, just paying attention with slightly more than usual attention. Mara spent those 40 minutes in the surgical recovery corridor, not inside the recovery bay. She didn't have clearance to be in recovery under the terms of the suspended suspension, which was a real status that apparently existed, and which Gould had communicated through Keene with the specific language of someone covering himself from multiple directions simultaneously. She stood outside the recovery bay doors and read Reyes's numbers through the glass panel in the door, and she talked to the recovery nurse through the door when she had questions. And she waited. The recovery nurse was a compact, efficient man named Todd, who had been in surgical recovery for 8 years and had seen enough unusual situations to take this one mostly in stride. He came to the door every 15 minutes and gave her a verbal update in the low, precise language of someone reporting to a superior, which Mara neither encouraged nor discouraged, because the priority right now was the information. At 2:14, Reyes's pressure dropped, not catastrophically, not the dramatic collapse she'd seen on the rooftop. This was a quieter drop, 106 to 89 over the span of 4 minutes, and then holding at 87, which was low enough to mean something was happening, but high enough that the recovery team had time to assess before responding. Todd came to the door. "He's dropping. Dr. Reyes has been paged." "What's his urine output been for the last hour?" Todd checked his tablet. 31 mils. Low. Not critical, but low, which in combination with the pressure trend pointed toward a specific possibility that Mara did not want to be right about. "Has he spiked a temp?" she said. Todd looked at the chart again. 37.8 40 minutes ago. It was 37.2 on admission to recovery. She looked through the glass at Reyes lying still in the bed, the chest tube draining into its collection chamber, the monitors tracking every variable, the slight rise and fall of his chest that was, at this moment, the most important thing in the building. A low-grade temp trending upward, dropping urine output, pressure decline. None of these things individually was necessarily alarming. Together, in a patient who had been in a field environment for 8 hours before extraction and who had blast injury in addition to the penetrating wound, they composed a picture that had a specific name. She knocked on the glass. Todd opened the door. "I need you to get Dr. Reyes to the bedside," she said. "And I need a lactate level and a procalcitonin run now. Don't wait for the page response. Pull her out of wherever she is." Todd looked at her. He was 8 years in recovery, and he knew what those labs meant in this context. "You think he's septic?" he said. "I think we need to know in the next 20 minutes, not the next 2 hours." Todd went for the phone. Mara looked through the glass at Reyes. His eyes were closed. The oxygen mask had been replaced with a nasal cannula, a good sign from an hour ago that now looked slightly different in the context of a trending fever and dropping output. His color was not right. It had been acceptable coming out of the OR. Now there was something under the skin that she recognized from a context that had nothing to do with hospital recovery rooms. She had seen that color on people in the field who were about to go very wrong. Dr. Anita Reyes arrived at 2:22, still in her surgical cap, moving fast. She came through the recovery corridor door and stopped at the glass panel and looked at the numbers, and then at Mara. "Walk me through it," she said. Mara walked her through it in 90 seconds. The temp trend, the output, the pressure curve, the time correlation with the blast injury. Reyes listened and her jaw tightened slightly, which was her equivalent of alarm. "Labs are running," Todd said from behind them. "We don't wait for the labs," Reyes said. "If she's right, we start empiric broad spectrum now, and we get ID on the phone." She was already going through the door. "Get me infectious disease and tell them I need a call back in 10 minutes, not 2 hours. The recovery bay came alive in the contained, purposeful way of a team that knew what it was doing and didn't need to perform urgency. Just produce it. Mara watched through the glass, tracking the sequence of interventions, reading the monitor numbers as they changed. At 2:31, the lactate came back. 3.8. Elevated, significantly, confirming what the clinical picture had been suggesting. Reyes appeared at the glass door. Her expression was controlled in the way that surgical expressions are controlled. Not hiding, just managed, because management was the job. "You were right," she said. "He's septic, probably seeded from the field environment. We're talking 8 hours with a penetrating wound in a non-sterile environment before extraction." She paused. "This is going to be a long night." "He can handle a long night," Mara said. "He's handled worse." Reyes looked at her for a moment. "You know him well." "Well enough. Then you should know—" Reyes stopped, recalibrated slightly. "He's going to need everything we have. This isn't over because the surgery went well." "I know," Mara said. "What do you need from me?" "Right now, stay close. The ID physician is going to have questions about the field environment that only you can answer." She paused. "And I need to know if there's anything in his medical history that isn't in the standard file. Allergies, prior injuries, anything that would affect antibiotic selection." He had a reaction to a sulfonamide antibiotic 3 years ago. Mild, rash and GI symptoms, no anaphylaxis, but it's in his classified file, not his standard medical record. Reyes absorbed this without blinking. "I'll make sure ID has that before they make a recommendation." She turned back toward the bay. "Don't go anywhere." Mara nodded. She wasn't going anywhere. Preston Hale found her at 3:07. She had moved from the recovery corridor to the small family consultation alcove near the surgical ward, not because she was hiding, but because standing in a corridor for 90 minutes produced a certain amount of institutional friction, and she had enough friction today without generating more. The alcove had a window that looked out on the hospital's east parking lot, 3 chairs that had been selected by someone who prioritized durability over comfort, and a small table with a box of tissues that nobody in the room had needed yet. She was sitting in one of the chairs with the tactical phone in her hand, running through a message thread from Vasquez, when Hale appeared in the alcove doorway. She looked up. He did not look the way he had looked this morning. This morning he had looked certain, the kind of certainty that belongs to people who have just set something in motion and are confident in the outcome. Now he looked like a man trying to determine which version of the next 5 minutes was going to be least damaging to him, and not quite finding an answer. "I want to talk to you," he said. "Okay." He came into the alcove and did not sit down. She did not stand up. The resulting geometry was slightly awkward, which she suspected was not entirely accidental on his part, but she had been in rooms with worse geometry and she let it go. "The JAG officer," he said. "Well, she's been in that conference room for 2 hours." "I know." "What is she looking for?" Mara looked at him. "The same thing any investigator looks for." "What actually happened?" Hale was quiet for a moment. He moved to the window and looked out at the parking lot and then turned back. "This morning, Gerald Musk, I want you to understand. I was reading that presentation as a primary cardiac event based on the available data. The EKG, the troponin, the Preston." She used his first name without particular intent, just as a way of stopping the list before it became something she had to sit through entirely. "I understand what you were reading. I was in the bay. I know what the initial presentation looked like. Then you know my call wasn't unreasonable. Your initial assessment wasn't unreasonable, she said. What happened after was. He looked at her. When I flagged the concern to Dr. Priest, the correct outcome was for the attending to evaluate and decide. That's what happened. That's how it's supposed to work. She kept her voice even. What happened after Gerald was in the OR? The complaint, the suspension, the way the report was written. That's different. Hale said nothing. The report characterizes me as reckless, she said. Gerald Musk is alive. The silence in the alcove was the particular quality of silence that occurs when someone has been presented with a version of events that is accurate and they have no structural counterargument, only a positional one. The JAG officer mentioned a federal review, Hale said. His voice was careful now, measured. It had lost the specific weight it carried this morning when he was still the person setting the terms of the conversation. She mentioned a federal inquiry, Mara corrected, into whether the suspension of a classified medical asset during an active emergency endangered a military officer's life. He stopped. That's a serious allegation. It is, she agreed. I didn't make it. She did, based on the timeline. Mara stood up. Not quickly, just stood, because sitting while he paced was a dynamic she didn't need to maintain. You suspended me at 10:38 this morning. The military transport team attempted to reach me at the hospital at 11:22, based on Colonel Reyes's specific request. They were told I was unavailable. Reyes went through 2 pressure crises in the next 20 minutes before they were able to reach my alternate contact and get me back to this building. She looked at him steadily. The federal interest is in that timeline, not in my opinion about it. Hale's jaw worked. She picked up the tactical phone from the chair. I don't think this conversation is productive right now, she said, and I have to get back to the recovery corridor. She walked past him. He didn't stop her. At the doorway, she paused without turning around. The complaint you filed this morning said I recklessly endangered a patient. The record is going to show what the record shows. I'd spend the next hour talking to your own attorney instead of me. She walked out. The infectious disease physician was a quiet, angular man named Dr. Samuel Obi, who had been in his specialty for 14 years and had the unshowy competence of someone who had stopped needing to perform expertise and now simply exercised it. He arrived at 3:20 and spent 15 minutes in the recovery bay with Reyes and then came out to talk to Mara in the corridor. Tell me about the extraction environment, he said. He had a small notebook and was writing in it, actual handwriting, which she found oddly grounding. She told him. Not everything. Some of it was classified and some of it she genuinely didn't know, because Vasquez's debrief had been limited to the medical essentials. But she gave him the environmental context. Forward operating environment, tropical adjacent, significant soil and water exposure, likely given the nature of the extraction, 8 hours in flight under field-managed wound care. Obi wrote and nodded and asked 3 follow-up questions that were precise and illuminating about how he was thinking through the antibiotic selection. She answered them as completely as she could. The sulfonamide sensitivity, he said. Mild presentation 3 years ago. Has he had any other drug reactions since? Not that I'm aware of. His file is current through 6 months ago. Anything after that I can't speak to. I'll work around it. Obi closed the notebook. We're going to need to culture everything we can from the drainage and do blood cultures in series. If this is what the lactate suggests, gram-negative bacteremia from field contamination, we're looking at a significant antibiotic course and close monitoring for the next 72 hours. What's your read on his prognosis? Obi considered the question with the seriousness it deserved. He's in serious condition. I won't minimize that. But he's also, from what Dr. Reyes tells me, in good baseline physical condition, and he's responding to the initial intervention. If the cultures come back and we can narrow the antibiotic coverage appropriately, and if he doesn't develop further complications, he paused. He has a real chance, better than most patients who come in with this picture. He's stubborn, Mara said. Obi looked at her. A small, brief expression crossed his face that might have been the beginning of a smile. That helps, he said, and went back through the bay door. It was Vasquez who found her at 4:15. He came through the surgical ward corridor in civilian clothes, dark jacket, nothing that identified him. But he moved in a way that identified him regardless, the particular quality of someone who was always aware of exits and angles and the placement of other people in a room. He was in his early 30s, dark-skinned, with a vertical scar below his left ear that Mara had been present for the creation of, though that was not a story for this corridor. "Commander?" He stopped beside her at the recovery bay window. "How's your team?" she said. "Holding. We've got 2 operators in the family waiting area downstairs. The rest went back to the staging location." He looked through the glass at Reyes in the bed. "How is he?" "Septic. Manageable. He's on broad spectrum and the ID doc has a plan." She paused. "He's going to be angry when he finds out." "He's already angry," Vasquez said. "He woke up for about 4 minutes at 2:30 and demanded a status report." "What did you tell him?" "That he was in a hospital, that the surgery was successful, and that you had been present." A pause. "He went back under. But before he did, he said—" Vasquez stopped. "What?" "He said to tell you the debt was paid." Mara was quiet for a moment. She knew what that meant. It referenced a specific event in a specific location that neither of them would ever discuss in a place like this corridor, and it was Reyes's way of communicating. Even through 4 minutes of post-surgical consciousness, even through sepsis, that he understood what she had done today and that it mattered. "Tell him we're even," she said. Vasquez nodded. Then, "There's something else." She looked at him. "The JAG officer, Weil. She's been briefed on the full picture, not just the emergency today, but the suspension, the complaint, the morning timeline. The people she's been talking to in that conference room." He paused. "Commander, it's not just Naval Medical Command anymore. There are people from the Inspector General's office on the line." She absorbed this. "When did that happen?" "About 90 minutes ago. From what I understand, the issue is not just the medical emergency. It's the nature of the complaint. Specifically, who Dr. Hale contacted after filing it, and how quickly the suspension was processed." Mara looked at him steadily. "What does that mean?" "It means someone may have called in a favor to accelerate the process. The standard timeline for a suspension of this type, based on the complaint as filed, would typically be 48 to 72 hours of administrative review before action." He held her gaze. "Your suspension was processed in under 40 minutes. She thought about Gould's office, the way Keene had the folder ready, the way the 2 security officers had been positioned at the door to the administrative wing before she arrived, as if the outcome had been decided before the conversation. The question being investigated," Vasquez continued, "is whether there was external coordination between Dr. Hale's complaint and the administrative decision. Whether someone with a relationship to Hale moved the process faster than standard protocol would allow." "Do they have anything?" she said. "They have a timeline that doesn't add up, and they have phone records that are—" He stopped. "That are being described as interesting." The word interesting in that specific usage carried a weight that both of them understood. Mara looked through the glass at Reyes. She had not asked for any of this. Not the investigation, not the military involvement, not Weil in the conference room or the IG on the phone. She had come back to this hospital today because a man she respected was dying and she was the person he had asked for. The rest of it was accumulating around that central fact like weather accumulating around a mountain. She hadn't caused it, but she was the reason it was here. "Vasquez," she said, "what do you need from me?" "Nothing right now. Weil has what she needs from the medical side. The rest is, He glanced toward the corridor. "The rest is institutional, above our level." "Not entirely," she said. He looked at her. "Hale came to talk to me an hour ago. He's worried." She kept her voice flat and informational. "If the investigation finds what you're suggesting it might find, he's not the only person who has a problem." "No," Vasquez agreed. "He's not." Choat. At 5:47, 3 things happened in rapid succession. The first was that Colonel Reyes's fever spiked to 39.2, a significant jump from the earlier trend, which meant the infection was not responding to the initial antibiotic selection as well as Obi had hoped. Dr. Obi was paged. Dr. Reyes was pulled out of a debrief she was doing with her surgical team. The recovery bay became busy in the specific way of a team managing a situation that had just changed category. Mara was at the glass when it happened. She watched Todd move with the efficiency she had observed all afternoon and thought that Todd was very good at his job, and that this was not a comfortable observation given what she was watching happen to the man in the bed. The second thing was that Martin Gould appeared in the surgical ward corridor with his jacket off and his sleeves rolled up, which was a small but notable departure from his usual presentation, and which suggested that the past several hours had been more difficult for him than he was showing. He was on his phone. He walked past her without looking at her, which told her that he knew she was there and was choosing not to engage, which itself told her something about what was happening in the conference room on the third floor. The third thing was that Susan Keene came to find her. Keene appeared at the corridor entrance, still composed, still carrying her tablet, but with something different in the quality of her composure. The HR composure that had been in place this morning had a different texture now, more careful, more precise. "Ms. Solis," she said, "Commander Weil is asking for you." "Is she?" "She'd like you to come to the conference room, when you're available." The "when you're available" was doing a lot of work in that sentence. It was not the language of this morning. "Tell her 20 minutes, Mara said. "I need to check in with Dr. Obi first." Keene nodded and walked away. Mara looked back through the glass. Todd was adjusting the IV rate. The monitor showed Reyes's pressure at 83, trending down again. His fever had moved the picture and Obi was going to have to shift the antibiotic approach, and the next few hours were going to determine a great deal about the next few days. She pressed her hand flat against the glass for a moment. Not a gesture she had planned, just something her body did. And then she turned and went to find Obi. He was at the medication station outside the bay, already pulling up the culture sensitivity panel on the computer. "What are we looking at?" she said. "Gram-negative rod. Preliminary sensitive panel is narrowing, but I need another 4 hours for the full picture." He was typing and talking simultaneously. "I'm adjusting to meropenem pending full sensitivity. It's broader, more aggressive, but the fever spike tells me we weren't covering the right organism with the initial selection." "What's his risk window?" Obi stopped typing. He turned and looked at her directly, which she appreciated because it meant he was going to give her a real answer. "The next 6 to 8 hours are the highest risk period. If the meropenem starts to work and we see the fever trend down before midnight, his odds improve significantly. If the fever continues to climb or we see another pressure event," he paused, "then we're looking at a much more complicated situation." She nodded. "I'll be in the building." "I didn't doubt it," Obi said, and went back to his screen. The conference room on the third floor was smaller than it looked from the outside, one of those rooms that seemed designed to create a mild sense of compression, which was either unintentional or extremely intentional, depending on who had designed it and for what purpose. Commander Patricia Weil sat at the head of the table with 3 folders open in front of her and a laptop showing a video call that she minimized when Mara came in. 2 other people were in the room, one of the men in civilian clothes from the corridor earlier, and a woman Mara had not seen before who was introduced as Dr. Louise Farrar from the Department of Defense Medical Oversight Office, which was an office whose existence Mara had been abstractly aware of but had never directly encountered. "Commander Solis," Weil said, "thank you for coming. You wanted to see me. Sit down, please." Mara sat, Weil folded her hands on the table. "I want to give you a summary of where we are. The investigation we initiated this afternoon has expanded in scope significantly over the past 2 hours. We began with a focused inquiry into the timeline of your suspension as it related to the military emergency. What we've found suggests that the scope needs to be broader." "The phone records," Mara said. Weil looked at her. "You know about that. I was told they were interesting." A brief pause. "Dr. Hale made 11 phone calls between the time he filed his complaint and the time your suspension was formally processed. One of those calls was to Martin Gould, which is expected. One was to Susan Keene, also expected. 3 were to the hospital's legal department, which is somewhat more accelerated than standard." She paused. "The remaining calls were to external numbers. One of them belongs to a member of Crestline General's board of directors, a member with whom Dr. Hale has a personal relationship that predates his employment at this institution." Mara was quiet. "The suspension was signed off by Gould at 10:31, Weil continued. "Your meeting with Gould and Keene ended at 10:26. The formal complaint had been filed at 10:09. She looked at Mara steadily. 22 minutes from complaint to suspension, Commander. For an allegation of this type, in an institution with the standard review protocol, that timeline is significantly irregular. What are you going to do with that? Mara said. We're going to continue investigating. The IG's office has been briefed and they are formally interested in the board member involvement. That piece is outside our jurisdiction and inside theirs. Weil leaned forward slightly. What I need from you right now is a complete account of this morning's events. Your account, in your words, starting from when you arrived at the hospital. Not the record you filed in the chart, which I have. Your account. Mara looked at her. She had told the story, in pieces, to several people over the course of the day. To Gould, to Hale himself, to Dr. Priest in passing. Each telling had been clipped and functional, compressed to the essential facts, because the essential facts were what mattered, and she had never had patience for the decorative version. But Weil was asking for something different, not the compressed version, but the full version, from the beginning, in her own language. How much time do you have? Mara said. As much as you need, Weil said. Mara started talking. She went through the morning chronologically. The early arrival, the overnight board, Gerald Musk's intake presentation, the clinical flag she had identified, the conversation with Dr. Priest, the moment in the bay when Reyes's monitor alarmed. She described the intervention, not defensively, just accurately, the sequence of clinical observations and decisions, and the specific moment when she had placed herself between Hale and the defibrillator. She described the meeting in Gould's office, the way the folder was already printed, the way Keene had the suspension language ready, the way Gould had looked at her when she said Gerald Musk was alive. She described walking out, the corridor, the box, the two security officers, and then she described the phone. Weil had been writing throughout, the civilian man had been recording with a small device on the table, and Dr. Farrar had been watching her with the particular attention of someone who was evaluating not just content, but the person delivering it. When she finished, the room was quiet for a moment. Weil said, "One question. When you returned to the hospital, when you came back through the ER entrance before the helicopter arrived, what was your intention?" Mara considered the question honestly. "My intention was to make sure the hospital was ready," she said, "and then to be there when the helicopter landed. Not to contest the suspension. The suspension was going to be what it was going to be. That wasn't the priority." Weil studied her for a moment. "Colonel Reyes is your priority." "Colonel Reyes was the priority?" "Yes." Another pause. Then Weil said, "Commander, I want to be direct with you about something. What we're uncovering here, if it holds up under the full investigation, is not a straightforward administrative error. The acceleration of your suspension, the board member involvement, the nature of the complaint given the clinical outcome." She stopped. "This has the shape of something deliberate." Mara said nothing. "The question I can't answer yet is whether Dr. Hale understood the full implications of what he was doing. Whether this was a panicked overcorrection by a physician who felt professionally threatened, or whether it was a calculated action by someone who knew specifically how to use institutional process to neutralize a credible witness to his clinical error. The word witness landed in the room with a specific weight. "Gerald Musk," Mara said. "Gerald Musk survived an aortic dissection in your facility this morning," Weil said carefully. "And the physician who initially misread his presentation filed a formal complaint against the nurse who corrected it, within minutes of the patient going to the OR, before the outcome was even confirmed." The room was very quiet. Dr. Farrar was still watching Mara with that specific attention. "The timeline of the complaint," Farrar said, her first words since Mara had entered the room, "suggests Dr. Hale filed while Gerald Musk was still in surgery, before anyone in this hospital knew for certain whether the patient had survived his procedure." Mara had known this. She had known it since she read the timestamp on the formal complaint paperwork in Gould's office, though she had not said it aloud because saying it aloud in Gould's office would not have accomplished anything. "He filed the complaint," Weil said quietly, "before he knew whether the patient he had nearly killed was going to live." Outside the conference room, in the hallway, she could hear the ordinary sounds of the hospital's late afternoon. The PA system, a cart rolling past, someone's pager going off at the nurse's station down the corridor. The ordinary sounds of an institution continuing to function while something significant happened inside it. Mara sat with the weight of what Vile had just said and did not let anything show on her face, because there was nothing she could do with the feeling right now, and feeling it fully would have to wait for a time when the feeling was useful. "What happens next?" she said. Weil opened her mouth to answer, and then her phone rang. She looked at the screen. Her expression did not change, but the quality of her stillness changed. She went from the stillness of someone running a controlled process to the stillness of someone receiving information that required immediate recalibration. She answered, listened for 10 seconds. "When?" she said. A pause. "How certain?" Another pause. "Don't move anything. I'm coming down." She ended the call and looked at Mara. "There's been a development," she said. Mara waited. Security footage. Weil was already closing her folders, the practiced efficiency of someone shifting operational gears. "From the trauma bay this morning, there's a camera angle that the administrative team apparently did not account for when the incident reports were being compiled." She stood. "It captured the full sequence. From the moment you flagged the concern to Dr. Priest to the moment Dr. Hale moved toward the defibrillator." "They have it on tape," Mara said. "All of it," Weil said, "including Dr. Hale's physical position relative to the equipment at the time he gave the order to shock." She looked at Mara with an expression that was not quite anything she could name, not satisfaction, not triumph, just the measured acknowledgement of a fact landing exactly where it was always going to land. He was not where his incident report says he was. The room went silent. Down the hall, a pager went off again. Then another. Then the overhead PA system crackled to life. Not an announcement, just the alert tone that preceded a critical page. And Mara heard it and felt something shift in her before the words even came through. Code blue. Surgical recovery. Code blue. Surgical recovery. She was already out of her chair. She was already out of her chair. The conference room door swung behind her and she was moving down the third-floor corridor before Weil had finished standing, not running, because running in a hospital was its own kind of signal, and she needed people to move with her. Not freeze watching her, but moving fast enough that the two people she passed in the hallway stepped aside without being asked. The stairwell was faster than the elevator. She took it. Surgical recovery was on the second floor, east wing, and she knew the building well enough to cut through the supply corridor rather than the main hallway, and she came through the recovery ward doors at a different angle than the code team, which meant she arrived at the bay window at the same moment the crash cart did, rather than 30 seconds behind it. Through the glass, she could see Todd already at the bedside, doing compressions, controlled, metered, the correct depth and rate. His face showing the particular focused blankness of someone who has been trained for this and is executing the training rather than processing the emotion of it. Reyes's monitor showed V-fib, not the sinus tach with pressure drop from the afternoon. This was the real thing, chaotic electrical activity, the heart no longer pumping in any coordinated sense, just quivering. She pushed through the bay door. "What happened?" she said to Todd, not loudly, cutting across the noise of the arriving code team. "Fever spiked to 40.1 about 6 minutes ago," Todd said without breaking compression rhythm. "Pressure went to 60 over palp, and then we lost the rhythm. I started compressions immediately." The code team was 4 people. An ER resident named Dr. Walsh, who was running the code, a second nurse, a respiratory tech, and a pharmacist already drawing medications. Walsh was good. She had seen him run codes before. He was organized and fast. But he was an ER resident, and what was happening in this bay was a post-surgical septic patient with a repaired vascular wound, and the calculus of running this code was not the same as a standard cardiac arrest. "Dr. Walsh," she said. He looked up from the crash cart. "The repair site," she said. "If we shock him, and the defibrillation current destabilizes the subclavian repair, he'll bleed out faster than we can get back into the chest." Walsh looked at the monitor, looked at her. "Who are you?" he said, not hostilely, just practically. The question of a physician who needed to know whose input he was receiving. "I'm the person who identified his injury profile on extraction and was in the OR for the repair," she said. "And I'm telling you, the defibrillation risk is real." Walsh looked at the monitor again. He was thinking fast, she could see it. running the probabilities, weighing VFib against vascular re-bleed, understanding that both outcomes were bad, and one of them was worse. Amiodarone first, she said. Chemical cardioversion before electrical. Give it a real chance to work. If it doesn't work in 2 minutes, then we shock him and we deal with what comes next. But try the amiodarone first. Walsh made the call. Amiodarone, 300 milligrams IV push. The pharmacist had it drawn. The second nurse pushed it through the line. Todd kept compressing. The monitor kept showing VFib. The bay was very loud with the sounds of a code, equipment, voices, the percussion of compressions, and very loud in another way that had nothing to do with sound, the particular weight of a room where everything is aimed at one outcome and nobody knows yet whether the aim is true. 53 seconds after the amiodarone push, the monitor changed, not to normal sinus, not immediately. It went through a brief period of something that looked like organized chaos, wide, complex beats, irregular, then narrowing, and then at the 1 minute 12-second mark it found a rhythm. Sinus tach at 130, pressure returning, 60, 72, 81. Todd stopped compressions. His shoulders dropped slightly, the unconscious release of a body that has been holding itself at maximum function for several minutes. We're back, Walsh said. He exhaled once, controlled. Okay, let's talk about why this happened and what we do for the next 6 hours. Mara was already looking at the monitor, reading the new numbers, recalculating. Reyes was back, but he was not stable, not close to stable. The fever at 40.1 was still there, still driving, and the rhythm they had just recovered could deteriorate again if the underlying infection wasn't controlled. And the amiodarone that had saved him was also going to complicate the next several hours of management in ways that would require careful calibration. She found Dr. Obi in the corridor 30 seconds later. He had arrived during the code and had held at the doorway. The right call, one more body in that bay would have been one more body, and he was already on his phone. Culture sensitivity is back, he said when he saw her. It's pseudomonas, resistant to the initial coverage. That was why the fever had spiked. That was why the rhythm had broken. The organism was not responding to the first antibiotic and had been running unchecked for the past 2 hours. Meropenem will cover it, she said. Meropenem plus tobramycin for synergy. I'm calling it in now. He was already typing into his phone. We should see fever response in 4 to 6 hours if the coverage is right. And if it's not right? Obi looked at her directly. Then we're having a different conversation. She nodded. He moved back toward the bay. She stood in the corridor for a moment with her hand pressed against the wall, not leaning on it, just touching it, the way you touch something solid when the ground has been unsteady for a while. Reyes had arrested and come back in the span of 4 minutes. If the amiodarone hadn't worked, if Walsh had shocked him and the current had destabilized the repair, if she hadn't been in the building at all today, still suspended, sitting in her apartment in Denton, not knowing any of this was happening. She took a breath, then she went back to work. At 7:22 that evening, Preston Hale was called to Martin Gould's office. Mara did not know this immediately. She learned it later through Diane Forsyth, who learned it through the administrative assistant, whose desk was outside Gould's office, and who had, over the course of this particular day, become an inadvertent primary source of information about events on the 3rd floor. What happened in Gould's office was not recorded and would be reconstructed later through several accounts that agreed on the substance, if not all the specifics. Gould had the security footage. Not just the clip from the trauma bay that Weil had referenced in the conference room. The full sequence pulled by the hospital's IT security team under the formal request from the JAG office, covering the trauma bay from 6:45 that morning through 1100 hours. 4 hours and 15 minutes of footage from 3 different camera angles, including one camera mounted near the trauma bay ceiling that had a line of sight to the crash cart position that nobody in Hale's incident report had accounted for. The footage showed the following: Gerald Musk's deterioration, Mara's call for the crash cart, the arrival of the code team, Hale's arrival, Hale's assessment, the moment Hale said defib ready and moved toward the defibrillator, the moment Mara stepped into the space, the 3 seconds she occupied it, the arrival of Dr. Priest, the decision to hold. What the footage also showed, clearly, from the ceiling angle, in a way that was not subject to interpretation, was Hale's physical position relative to the defibrillator controls at the moment he gave the order to shock. His incident report stated that he had been positioned at the patient's left side, conducting assessment, when Mara intervened. The footage showed him at the defibrillator, hand on the control panel, in the act of initiating the shock sequence. He had not been assessing. He had been shocking, or rather, he had been in the process of shocking when Mara stepped in front of him. If she had not moved, Gerald Musk would have received a defibrillation shock for a rhythm that did not require defibrillation in a patient whose actual condition, aortic dissection, made that shock potentially fatal. The incident report had described Mara as intervening recklessly. The footage showed her preventing an error that would have killed the patient. These were not the same event. Gould had watched the footage twice before calling Hale in. Weil had watched it 3 times with Dr. Farrar from the DoD Oversight Office. The IG representative had watched it once and spent the following 40 minutes on the phone. When Hale came into Gould's office at 7:22, the laptop was open on the desk with the footage cued to the ceiling angle, paused at the frame showing Hale's hand on the defibrillator control. The conversation that followed lasted 26 minutes. Mara was not present for it. She was in the surgical recovery corridor, watching Reyes' fever number on the monitor through the glass, willing it to move in the right direction. It started moving at 8:41. 40.1 had become 39.6 by 7:30, which was not enough. 39.6 had become 39.1 by 8:15, which was better, but still not enough. But at 8:41, the number on the monitor read 38.7, and the pressure was holding at 94/60. And Todd, who was 2 hours into what should have been the end of his shift and had not left, came to the glass and held up his tablet showing the latest lactate, 2.1, down from 3.8 at the height of the crisis, moving in the right direction. She pressed her hand flat against the glass again, the same gesture as before, and this time she let herself feel the thing she had been not feeling for the past 4 hours, which was that she had been genuinely afraid for him, in the specific way you were afraid for someone whose survival you had made your work, but whose life was not yours to control. The fear didn't help anyone, which was why she had put it away. But it had been there. She took it out for 30 seconds, acknowledged it, and put it away again. Then she went to find Vasquez. He was in the family waiting area on the first floor with the 2 operators who had remained behind, all 3 of them doing the particular waiting that military people did. Not restless, not visibly anxious, just present, contained, available. Vasquez looked up when she came through the door and read her face before she said anything. "He's stabilizing," she said. Vasquez closed his eyes for 1 second, just one, then opened them. "Fever's coming down," she continued. "Lactate trending toward normal. He arrested at 1738, V-fib secondary to the septic spike. We cardioverted with amiodarone, and he's been in sinus since." She sat down across from him. "Dr. Obi has the right antibiotic combination now. If the next 4 hours hold, the critical window is closing." One of the operators, a younger man she didn't know, who had been sitting with his forearms on his knees staring at the floor, exhaled and leaned back in his chair. "He arrested?" Vasquez said. "For 4 minutes." Vasquez was quiet for a moment. "Does he know?" "He's been sedated since the event. We'll tell him when he's stable enough for the information not to be a problem." Vasquez nodded slowly. He looked at her for a moment with the expression of someone assembling a complete picture from components they had been receiving throughout the day. "Commander," he said, "I need to tell you something." She waited. "The IG representative made a call about 45 minutes ago. I was told about it through the team's legal liaison." He leaned forward slightly. "They're not just looking at the suspension timeline anymore. They found something in Hale's personnel file, a prior complaint at his previous institution, Mercy Regional in Boulder, 18 months before he came to Crestline General." She was still. "Same pattern," Vasquez said. "Nursing staff raised a clinical concern. The nurse was disciplined. The patient outcome, the one the nurse was right about, was documented as a complication rather than a misread." A pause. "The complaint was resolved internally. The nurse left. Hale moved to Crestline General with a clean recommendation." The pieces of this had a shape she recognized. Not the shape of a single bad day, not the shape of a physician who panicked and overcorrected, the shape of a pattern, repeated, refined, institutional. "Who wrote the recommendation?" she said. The chief of medicine at Mercy Regional. Vasquez paused. Who is a personal friend of the board member that Hale called this morning after filing his complaint. The room was quiet. The younger operator was watching her. The third one, a woman, she realized, who had said nothing since Mara entered, was watching her too. That's a circle, Mara said. It's a circle, Vasquez agreed. Does Weil have this? She has it as of 40 minutes ago. Mara looked at the wall behind Vasquez's head for a moment, not seeing it. She was thinking about the nurse at Mercy Regional who had been right about a patient and lost her job and left, and who probably had no idea that the man who had taken her career was still running the same play 18 months later at a different institution, this time against someone who happened to have a classified military designation and a set of circumstances that made the play visible in a way it hadn't been the first time. The first nurse had not been lucky enough to have a helicopter land on the roof. Is there a name? She said. The nurse? Yes. Catherine Marsh. She's working at a clinic in Fort Collins. Mara filed that name in the specific part of her memory where things went that needed to be returned to when the immediate situation was handled. Okay, she said. She stood up. I need to go back upstairs. Commander, Vasquez stood with her. For what it's worth, and I know it's not worth much right now, what you did today. Coming back here. The OR, the code, all of it. He paused in the way of someone who was not accustomed to this kind of sentence and was finding it difficult to complete. He's alive because of you, twice today. He's alive because of a surgical team and an infectious disease physician and a recovery nurse who didn't leave when his shift ended, she said. I was one part of it. You were the part that made the other parts possible. She looked at him for a moment. Get some sleep, Vasquez, she said. One of you needs to. She went back upstairs. At 9:15, Martin Gould came to find her. He found her in the surgical recovery corridor, where she had been for most of the evening, and he stopped beside her at the glass panel and looked through it at Reyes in the bed. The monitors steady now, the numbers moving in the right direction, the chest tube draining cleanly, the IV lines doing their work. He stood there for a moment without saying anything, which surprised her slightly. The footage, he said finally. I know about the footage. I owe you an apology. He said it without the cushioning language she would have expected from him. No, this is a difficult situation, or I want you to understand that I was operating on incomplete information. Just the apology, stated flatly. She looked at him. The timeline was irregular, he said. I knew that when it was happening. I knew the process was moving faster than it should, and He stopped. I had a relationship with the board member, not a personal one, a professional one. He's been on the board for 11 years, and he has a significant influence on operational decisions, including decisions about departmental leadership. A pause. I understood what it would cost to slow the process down. So you didn't. I didn't. He was looking through the glass. The footage changes the picture. Significantly. The report Hale filed describes an event that the camera doesn't show. No, Mara said. It doesn't. Commander Weil has made it very clear that the IG's office is going to pursue this fully. He glanced at her briefly. Dr. Hale has been placed on administrative leave, effective as of an hour ago, pending the outcome of the investigation. The board member has been contacted by the IG's office, and Another pause. I've been advised to cooperate fully, which I intend to do. And the suspension, she said, formally lifted as of 7:58 this evening. The record will be corrected. He finally turned to look at her directly. Ms. Solis, Commander, I made a series of choices today that I am going to have to account for. I understand that. A pause. But I want you to know that the outcome with Colonel Reyes, the work that was done in this building today, that doesn't get accounted for properly without you in it. She looked at him. She believed him. Not entirely. She had spent enough time in institutional environments to understand that Gould's current posture was shaped in part by what the IG investigation meant for his own position, and that a man who had been willing to expedite a fraudulent suspension that morning was not the same man as the one standing here now because of some internal moral recalibration. People were more complicated than that, and simpler. But she believed the specific sentence, the part about the outcome. Gerald Musk is still in recovery, she said, So is Colonel Reyes. The outcome isn't determined yet. Gould nodded once. He looked through the glass again at Reyes. Will he make it? He said. He's going to make it, she said. She said it the way she had said it to Vasquez from the rooftop that morning, before she even had data to support it, not as a prediction based on evidence, but as a statement of intent, the kind that functioned in her framework as something closer to a commitment. Gould left. She stayed. At 10:40, Dr. Obi came to the corridor with his notebook and his pen and stood beside her at the glass. Fever's 37.9, he said. She looked at him. Pressure stable at 98/62 for the past 90 minutes. Lactate 1.8. He opened his notebook and made a mark. He's responding to the meropenem-tobramycin combination. The critical window. He paused and chose his words in the specific way of a physician who did not make promises but occasionally acknowledged facts. Is effectively closing. She let out a breath. He's not out of the woods, Obi added. I want another 24 hours before I use comfortable language. But the trajectory is... Another pause. The trajectory is what we needed it to be. Thank you, she said. Thank Todd, Obi said. He caught the deterioration fast, and thank whoever called that amiodarone in the code because... He stopped and looked at her. That was you. Dr. Walsh made the call, because you told him to. She didn't argue with that. Obi made another mark in his notebook and went back to his office. She looked through the glass at Reyes for a long moment. His color was better. Even in the low light of the recovery bay, she could see it. The gray had receded, replaced by something closer to his normal register. His chest was moving evenly. The monitors were steady. She had not eaten since 6:30 that morning. She was aware of this in the abstract way of someone whose body had long since stopped sending relevant signals and was simply running on reserves, which she had done before and which had consequences she would deal with later. She found the break room on the second floor and poured herself a cup of coffee that had been sitting long enough that it was more texture than flavor, and she stood at the counter and drank it and looked at the wall. The wall had a bulletin board with the usual hospital bulletin board things, a sign-up sheet for a charity run, a notice about updated parking procedures, a photograph from someone's retirement party 3 months ago with a lot of people in scrubs smiling at the camera. She found Diane Forsyth in the picture. Found Todd, younger looking, in the back row. Found 2 nurses she recognized from this morning's corridor, the ones who had been whispering when she walked out. She looked at the picture for a moment and then looked at her coffee. Her phone, her personal one, had 17 missed notifications. She scrolled through them briefly. Her sister in Phoenix, a friend, 2 work contacts whose messages predated the morning's events and were now so contextually distant they might as well have been from a different year. She would get back to all of it, not tonight. She put the phone away and finished the coffee and went back to the recovery corridor. At 11:58, nearly 14 hours after she had first walked through the ER entrance that morning, the recovery bay door opened and Todd came out. He had finally changed into street clothes. He had changed an hour ago, but come back, she realized now, not because anyone asked him to, but because the shift didn't feel finished. He's asking for you, Todd said. She looked through the glass. Reyes was awake. His eyes were open and tracking, which was different from the intermittent consciousness of the afternoon. This was real wakefulness, the eyes of someone who was present and oriented and had questions. She went in. The bay was quiet at this hour, just the monitors and the ambient sound of the hospital's night shift. She pulled the chair from the corner to the bedside and sat down so she wasn't standing over him, because that was the better geometry for this. His eyes found her immediately. "Commander," he said. His voice was rough. The tube, the anesthesia, the hours of compromised oxygenation, but present, controlled. "Colonel, tell me." So she told him. The surgery, the dissection, the shrapnel placement, the repair, the sepsis, the pseudomonas, the antibiotic adjustment, the fever curve, the arrest, 4 minutes, amiodarone, cardioversion, recovery. She gave it to him straight, no softening, because he would have rejected softening and because he deserved the real account. He listened without interrupting. His eyes stayed on her the whole time. When she finished, he was quiet for a moment. 4 minutes, he said. Todd had you back in 4. Reyes looked at the ceiling for a moment. That's not a comfortable number. No, she agreed, but I'm here. You're here. He looked back at her. Vasquez told me what happened. This morning, the suspension. A pause. The whole thing. It's being handled. I want to, Colonel. She met his eyes. It's being handled. You focus on the next 72 hours. That's your assignment right now. He looked at her with the expression of a man accustomed to giving assignments rather than receiving them, processing the experience of being on the other side. How's the patient? He said. The one this morning, from what Vasquez said. Recovering. Surgery went well. He's going to be okay. Reyes nodded slowly. Because you were there. Because I was there, she said, without false modesty. Because false modesty was its own kind of lie, and he would have called it out. Good, he said simply. They sat in a brief silence that was not uncomfortable. The silence of two people who had been in enough difficult situations together that silence between them carried no particular charge. Then Reyes said, The debt comment I sent through Vasquez. I told him we're even. We're not even, Reyes said. We are. We're not. His eyes were steady. But I'll let you think so for now. She almost smiled. Almost. Get some sleep, Colonel, she said. You arrested today. You've earned it. She stood up. She put the chair back against the wall with the same quiet care with which she did everything in patient spaces. At the bay door, she paused. Mara, he said. She hadn't heard him use her name in 4 years. He was a rank and title person by instinct, by training, by 20 years of institutional habit. She turned. Thank you, he said, for coming back. She looked at him for a moment. You would have done the same, she said. She went out. The third floor was mostly quiet at this hour. She was walking toward the stairwell, intending to check in one more time with Obi's night coverage team before she finally left, when she saw the light still on in the conference room at the end of the corridor. Through the glass panel in the door, she could see Commander Weil still at the table, the laptop open, the folders reorganized into different stacks than they had been earlier. The civilian man was gone. Dr. Farrar was still there, speaking quietly on her phone. Weil saw Mara through the glass. She stood and opened the conference room door. How is he? She said. Stabilizing, fever's down, pressure's holding. Weil nodded. Then, there's something you should know. It came through in the last hour, and I wanted to tell you directly, before you heard it through other channels. Mara waited. The board member Hale called this morning. A man named Victor Crane, 11 years on the Crestline General Board, has retained outside counsel. Weil's voice was carefully level, which is his right, but the IG's office has also found, in the course of the phone record review, evidence of 2 prior occasions on which Crane intervened in internal hospital personnel matters. Both occasions involved physicians he had personal relationships with. Both involved the acceleration of disciplinary action against clinical staff who had raised concerns about those physicians. I tried bashordishte 3 times. The shape of it was larger than she had thought. Dr. Hale was not operating alone, Weil continued. He had a network. Not a conspiracy, exactly. Nothing that organized, but a pattern of relationships that consistently produced the same outcome. Clinical concerns raised by nursing staff, silenced through institutional process, with the cover of a colleague willing to move the machinery. And Catherine Marsh, Mara said, Weil looked at her. You know about Marsh, Vasquez told me. Her case is being reviewed. The IG's office has been in contact with her. A pause. She doesn't know yet that any of this is happening. Mara thought about a nurse in Fort Collins who had been right about a patient and lost her job for it and moved on, in the specific way people moved on when an institution had taken something from them and there was no mechanism for getting it back. Until now, there hadn't been. What happens to Hale? She said. We'll consider the question with the care she brought to all of them. Based on the footage alone, the discrepancy between his incident report and what the camera shows, he's looking at a formal disciplinary proceeding that will likely end his privileges at this institution. The question of the patient safety implications, the prior complaint at Mercy Regional, and the Crane connection, she paused. That extends the scope significantly. The medical board will be involved. The outcome there depends on what the full investigation reveals. And Crane? Board members don't have criminal liability for accelerating an administrative process, as a general matter. But if the IG finds that his interventions created conditions that directly endangered patients, including today with Colonel Reyes, that analysis changes. Weil held her gaze. We're not done, Commander. This is not resolved, but the direction it's moving in is clear. Mara nodded. She looked at the conference room, the folders, the laptop, the organized evidence of a day's worth of accountability being assembled into something that would outlast the day. There's one more thing, Weil said. Her voice had changed slightly. Not more formal. Different. The voice of someone delivering information that sat in a different category than the rest. Mara waited. The Naval Medical Command has been reviewing your status since this morning's emergency. The circumstances of your separation from active duty 2 years ago, the reasons you took the civilian position here, those records were re-examined today in the context of everything that happened. Weil paused. I'm not authorized to make any representations about what comes from that review. But I want you to know that the review is happening and that the people conducting it have full access to your service record. Mara was very still. The complete record, Weil added, not the summary, all of it. The corridor was quiet. Somewhere in the building, a night shift cart rolled past on the floor below them, the wheels making that particular quiet squeak on hospital linoleum that she had heard 10,000 times. She understood what Weil was telling her. Not the specifics. Those would come later, through channels and processes that would take their own time. But the shape of it, the outline of a door that had been closed for 2 years and was being, for the first time, looked at again. She had left active duty for reasons that were her own, had come to Denton and taken the nursing position at Crestline General and built a life that was quieter and smaller and more stationary than the one before it, and had told herself that was fine, that quiet was what she needed, that the smaller life was still a good one. She had believed it, mostly. Commander Weil, she said. Yes. Is there anything else tonight? Weil looked at her for a moment. No, go get some rest. Mara turned toward the stairwell. She had her hand on the stairwell door when she heard footsteps behind her. Fast, purposeful, the footsteps of someone who had been running from somewhere and was arriving with news. She turned. It was one of Weil's civilian team members, the man who had been in the conference room, who had left an hour ago. He was moving fast, and his face had the quality of someone carrying something important and trying not to drop it. He went past Mara into the conference room and said 3 sentences to Weil in a low, rapid voice. Weil's expression did not change, but she looked up at Mara through the open doorway, and what she said next stopped everything. The hospital's security system, Weil said slowly. The footage from this morning. The IT team just discovered that someone attempted to delete it, a pause that lasted exactly long enough. The deletion request was submitted at 10:47 this morning. Mara did the math instantly. 10:47, 14 minutes after her suspension had been formally signed. 16 minutes after Gerald Musk had gone into the OR. It failed, Weil continued. The hospital's backup system retained a copy automatically, but the deletion request is logged. It has a user ID attached to it. She paused. It's not Hale's ID. The corridor was completely silent. Whose is it? Mara said. Weil looked at her. Victor Crane, she said, has a hospital system administrator account. He's had one for 11 years as a board member with facility oversight responsibilities. The stairwell door was still cold under Mara's hand. She stood there for a moment, in the quiet of the third-floor corridor at midnight, with the weight of what that meant settling into its full shape. Crane hadn't just called in a favor. He had tried to erase the evidence, which meant he had known, before the evidence was gathered, that there was something worth erasing, which meant he had known, before the evidence was gathered, that there was something worth erasing. Well, was already on her phone before Mara had finished processing the full weight of it. Dr. Farrar was closing her laptop and opening a different folder, the specific motion of someone shifting from one phase of an investigation to another. The civilian team member who had brought the news was standing near the door with the alert posture of someone waiting for instructions. Mara stood in the corridor doorway and watched all of it happen with the particular clarity that came at the end of very long days when the body had burned through everything else, and what remained was something more basic. Not energy exactly, but focus, stripped of everything that wasn't essential. "I need to make a call," Weil said, not to anyone specific, which meant everyone in the room understood she was leaving the conversation for a moment. She stepped toward the window and spoke in a low voice. Farrar looked at Mara. "You should go home," she said. Not unkindly, practically. "There's nothing more you can do tonight, and tomorrow is going to require you to be functional." "What happens tomorrow?" Mara said. "The IG's office opens a formal proceeding against Victor Crane at 9 in the morning. Weil will be filing the supplemental evidence package with the State Medical Board regarding Dr. Hale by noon." Farrar paused. "And there will be a conversation with you that you need to be rested for." Mara looked at her steadily. "What kind of conversation?" Farrar met her eyes. "The kind that requires the other party to have slept." That was all she would say. Mara understood that pushing would not produce more information and that Farrar was, in the professional sense, correct. She said goodnight to the room and went down the stairwell and checked in with OB's night coverage physician, a quiet resident named Dr. Patel, who had Reyes's numbers memorized and recited them without being asked, which Mara appreciated. And then she walked out of Crestline General for the second time that day. This time nobody was watching. This time the box was not in her arms. She sat in her truck in the parking lot for a moment. The Denton night was cold and clear, the kind of cold that had edges to it, and the hospital's exterior lights made the parking lot look slightly unreal, the way things looked when you had been awake for too long and the world had stopped processing correctly. She drove home. She ate a bowl of cereal standing at her kitchen counter because it was the fastest thing available, and her body had stopped asking politely and moved on to demanding. She took a shower. She set her alarm for 6 and was asleep before she had finished the thought that she should probably also set a backup. But she did not sleep well. This was not surprising. She had not slept well after difficult days for most of her adult life. Her nervous system had been trained for a different kind of alertness than sleep required, and on days when it had been called on, it did not simply switch off at the agreed-upon time. She woke twice, once at 2:40 and once at 4:15, and lay in the dark both times running through variables that she had no new information about and that running through them would not resolve. She thought about Reyes's fever number. She thought about Gerald Musk in his recovery room and his wife Margaret, who had been sitting alone in the surgical waiting area with a paper cup of coffee, waiting. She thought about Catherine Marsh in Fort Collins. She got up at 5:40, 20 minutes before the alarm, and made coffee that was better than the break room version, and stood at her kitchen window looking at the Denton morning assembling itself in the dark, and told herself that today would be what it was going to be, and that preparing for it would not change its shape. She was at the hospital by 6:50. Reyes's fever was 37.3. Todd had gone home at some point in the early hours, but had left a detailed note for the day nurse that was more thorough than most formal handoffs Mara had seen, which told her something about the kind of nurse Todd was that she had already known but confirmed anyway. The day nurse was a woman named Patricia, who had been in surgical recovery for 6 years, and who read Mara's presence in the corridor with the calm acceptance of someone who had been briefed on the situation and had decided to prioritize the patient over the institutional complication. "He's been awake since 5, Patricia told her through the glass. "Asking questions. Wanting to see his phone." "His phone is a security concern," Mara said. "That's what I told him. He didn't love that answer." "No," Mara agreed. "He wouldn't." She went in. Reyes looked better than he had at midnight. The color that had returned the previous evening had held through the night, and his eyes were sharper. The eyes of someone who had slept and whose brain had used the sleep to begin the process of catching up with everything the body had been through. He looked at her when she came in. 37.3, she said before he could ask. "Pressure?" 102/66, stable through the night. He was quiet for a moment, absorbing the numbers. "You look terrible," he said. "I drove home and came back," she said. "You arrested yesterday. I think you forfeited the right to comment." Something moved in his face. The beginning of a real expression, not the managed minimalism of a man conserving resources, but something closer to what he actually looked like when he was not running on medical crisis. "Sit down," he said. She sat. "Vasquez gave me a full brief this morning. 6:40. He stood at the foot of my bed and gave me the whole operational picture. Reyes paused. The footage. Crane. The prior complaint at Mercy Regional. The nurse there. Catherine Marsh, Mara said. Catherine Marsh. He repeated the name with a specificity that told her he had already filed it in the same category she had. What's happening today? She told him what Farrar had told her. The formal IG proceeding against Crane at 9, Wiles' supplemental package to the medical board by noon. He listened the way he always listened, completely, without moving much, storing everything. And you? He said. What's your status? Suspension formally lifted as of last night. Beyond that, she paused. There's a conversation scheduled that Dr. Farrar wouldn't give me details about. Reyes looked at her. What do you know? She said. He was quiet for a moment, longer than his usual processing pause, which told her the answer was something he was choosing how to say rather than something he was retrieving. I made some calls, he said finally, last night, before Vasquez took my phone away. You were recovering from cardiac arrest. I had 4 minutes of downtime, he said, with the specific dryness of someone who knew that was not the point and did not care. I called Naval Medical Command. I called the Surgeon General's office. I told them what happened here, all of it, from the beginning. She looked at him. I told them what kind of officer you are, he said, what your service record actually shows, what the circumstances of your separation 2 years ago looked like from my position. A pause. And I told them that this hospital, this city, is not where you're supposed to be, that what you're doing here, which is remarkable, and I mean that, is a fraction of what you're capable of. The room was quiet. She had a complicated response to this that she sat with for a moment before she said anything. Colonel, I know, he said. I know you didn't ask me to do that. I know you've been building something here and it matters to you. I know the last 2 years haven't been... He stopped. I know they haven't been nothing. They haven't been nothing, she agreed. But they haven't been enough, he said. For you, have they? It was not entirely a question. She looked at the wall beside his bed, the generic hospital wall, the monitor mounted to it, the IV line running from the pole to his arm, the entirely ordinary components of a room that had held something extraordinary in the past 18 hours. She had been trying for 2 years to be the quieter version of herself, had been genuinely trying, not performing it, had built routines and relationships and a clinical competence in the civilian context that she was proud of, had told herself that the part of her that operated in different registers was retired or dormant or appropriately archived. Yesterday had demonstrated fairly conclusively that it was none of those things. No, she said, they haven't. Reyes nodded once. The conversation Farrar mentioned, he said. I think I know what it is. Tell me. Not mine to tell, he said, but go in with your eyes open. The conversation happened at 10:30 in the same conference room on the 3rd floor, which had by this point accumulated enough institutional weight that it felt different to walk into than it had the previous afternoon. Commander Weil was there. Dr. Farrar was there. And a third person Mara had not met, a rear admiral named Marcus Webb, Naval Medical Command, who had the compact, deliberate manner of someone who said precisely what he meant, and had stopped bothering with the other kind of communication somewhere around his 30th year of service. He stood when she came in. She registered this. Commander Solis, he said. Sit down, please. She sat. He sat. Weil and Farrar sat. Webb folded his hands on the table and looked at her directly. I'm going to be brief because Colonel Reyes tells me you prefer that, and because Colonel Reyes, despite having arrested yesterday, apparently cannot be stopped from providing character briefings. She almost smiled. That's accurate on both counts. What happened here yesterday, Webb said, is being documented at the Naval Medical Command level as a critical incident with multiple layers of institutional and medical significance. The civilian investigation, Weil's work, the IG's office, will proceed on its own track and timeline. That's not what I'm here to discuss. He opened the folder in front of him. Your separation from active duty 2 years ago was processed under a set of circumstances that, upon review, were not fraudulent, but incomplete. There were elements of your final evaluation that did not reflect the complete operational record. He paused. We are in the process of correcting that record. That process will take approximately 3 weeks to complete through the formal channels. But I wanted to tell you in person that the correction is happening and what it will reflect. She was very still. Your record will show a separation with full honors, Webb said, retroactive to the original separation date. The evaluation that preceded your separation will be amended to include the operational contributions that were not documented at the time, for classification reasons that no longer apply. A pause. This is not a negotiation. This is us correcting an error. She said, I understand. There is also a second matter. He turned a page in the folder. Naval Medical Command is establishing a new trauma training and integration program, civilian-military interface, specifically focused on the kind of cross-sector expertise that was demonstrated here yesterday. The kind of knowledge that lives in someone who has done both, deeply, and knows where the gaps are. He looked at her. We would like you to lead it. The room was quiet. It would be a return to active duty, he continued. Commander rank, reinstated. The program would be based partly here in Colorado, partly at a naval facility in San Diego. You would have significant latitude in how it's structured. We're not handing you a blueprint, we're handing you a problem and asking you to solve it. A pause. Colonel Reyes, who apparently has opinions about everything including his own post-surgical limitations, has already volunteered to be on your advisory board. He's been awake for 4 hours, Mara said. He made the call at 5:45, Webb said. Before we called him. She looked at the folder on the table without seeing it. She thought about what it would mean. Not the logistics, those would be what they were, but the deeper thing, the question of what she had been doing for 2 years and what she was being offered now, and whether those two things were in contradiction or whether they were, somehow, sequential. Chapter and next chapter. She thought about Gerald Musk, who was alive in a recovery room in this building because she had been here. She thought about Reyes in the OR, the shrapnel pressed against the vessel wall, the careful work of holding still. She thought about the code at 1738, the amiodarone pushing through the line, the monitor finding its way back to sinus. She thought about the break room bulletin board and the photograph and the people in scrubs and what it meant to build something in a place and what it meant to leave it. The program, she said. The civilian-military interface. Would it include training for civilian nursing staff? Webb looked at her. If you design it that way. It should include training for civilian nursing staff, she said. The gap isn't just in the military personnel who go into civilian facilities. It's in the civilian clinicians who don't know how to read military injury patterns, how to communicate with operators, how to handle the specific presentation of field-managed trauma. Both sides need it. Webb made a note. Agreed. And I'd want to consult with the nursing staff here, she said. Before I leave, formally. Whatever they need from me in terms of transition or documentation. Of course. She looked at him. I'll take it. Webb nodded once. Good. He closed the folder. The formal paperwork will come through in the 3-week window I mentioned. In the meantime, a brief pause. What do you need right now? She thought about it. Coffee, she said. That isn't from the break room. Will, who had been silent throughout, made a sound that might have been a laugh suppressed into professionalism. The formal proceedings against Victor Crane began at 9 that morning, as Farrar had said they would. Mara was not present for them. She was in the hospital, which was where she needed to be, and she learned what happened through Vile, who gave her a summary at 2 in the afternoon with the efficient precision of someone who had been giving summaries all day. The IG's office had presented the deletion request, the logged attempt to access and remove the security footage, time-stamped at 10:47 the previous morning, attached to Crane's system administrator credentials, alongside the full phone record analysis showing the 11 calls, the history of prior interventions, and the Mercy regional connection. Crane had arrived with outside counsel and had declined to answer questions. His attorney had argued that the deletion attempt was unauthorized access by an unknown party using his credentials. The IG investigator had noted that Crane's credentials required biometric verification to access the security system's administrative functions, and that the biometric log showed a successful fingerprint authentication at 10:44, 3 minutes before the deletion request. Crane's attorney had asked for a recess. The formal outcome of the proceeding would take weeks, but the practical outcome of that morning was immediate. Victor Crane's board membership at Crestline General was suspended pending the investigation, and the hospital's legal team, now operating under a very different assessment of institutional liability than they had been 24 hours ago, had retained independent outside counsel to review every personnel decision Crane had been involved in during his 11 years on the board. That review, Weil told her, had already identified 6 other cases. 6 clinical staff members who had raised concerns, been disciplined, and left. 6 cases where the process had moved faster than it should have. 6 names that would now be examined with the same attention that was being applied to everything else. Mara sat with that number for a moment. 6 people who had done the right thing and paid for it and gone on to build their lives around the loss, because there had been no mechanism that made it worthwhile to fight and no reason to believe the institution would ever look at itself clearly. Now, there was a reason. Preston Hale's administrative leave became a formal suspension of clinical privileges at 3:15 that afternoon when the State Medical Board received Weil's supplemental package. The package contained the security footage, the incident report discrepancy analysis, the prior complaint from Mercy Regional, and a clinical outcomes summary prepared by Dr. Anita Reyes, who had submitted it voluntarily without being asked at 11 that morning, documenting the specific mechanism by which Gerald Musk had been saved and the specific intervention that had made the difference. Reyes's summary was 7 pages. It was precise and technical and completely unambiguous about what had happened in Bay 7 and what would have happened if the intervention had not occurred. She had titled it simply, Clinical Outcome Report, Patient Gerald Musk, Adverse Event Prevention. The medical board acknowledged receipt and opened a formal review. Hale's clinical privileges at Crestline General were suspended pending the outcome, which meant he could not practice there. The review process would determine what happened at other institutions. The process would take months. The outcome was not guaranteed, but the process was open and it was on the record, and this time it had been opened by the right people asking the right questions with the right evidence in their hands. Martin Gould announced his cooperation with the IG investigation in a written statement that was, by institutional standards, remarkably candid, acknowledging that the suspension timeline had been irregular, that he had been aware of Crane's influence on the process, and that he bore responsibility for not slowing it down. He did not resign, but the statement was the kind of thing that preceded resignations, and the hospital board, now operating under emergency governance given Crane's suspension, was conducting its own leadership review. None of this was clean. None of it resolved the way things resolved in stories, where institutions looked at their failures and immediately became different institutions. Real accountability was slow and incomplete and produced outcomes that were better than nothing, but not as good as justice in its clearest form. Mara knew this. She had worked inside enough structures to understand that what was happening here was meaningful and partial simultaneously, and that both of those things could be true. She held them both. Gerald Musk was moved from surgical recovery to a regular room on the 4th floor at 4 that afternoon. Mara found out from Diane, who had apparently appointed herself the informal intelligence network for Mara's movements through the building, and who delivered this information with the specific satisfaction of someone who had been watching events unfold and had strong opinions about how they should end. She went to the 4th floor, room 417. The door was open. Gerald was sitting up in the bed, still pale, still moving carefully, still connected to a monitor that was now more precautionary than essential, and his wife Margaret was in the chair beside him. Margaret Musk was a small woman in her late 50s with short gray hair and the composed manner of someone who had spent the past 30-some hours managing a terror she had not been allowed to show in front of her husband. When Mara appeared in the doorway, Margaret looked at her with the specific recognition of someone who had been told a name and was now attaching it to a face. Gerald looked at her too. He was quiet for a moment. His eyes were the eyes of a man who had been told, in the gentle clinical language of physicians who did this regularly, what had happened to him and what had been done about it, and who was still processing the distance between those two facts. "Ms. Solis," he said. "Mr. Musk, how are you feeling?" "Like someone took me apart and put me back." A pause. "Which, I'm told, is approximately what happened." "Approximately," she agreed. He looked at her for a moment. "They told me," he said. "Dr. Reyes. She came in this morning and she told me what you did." He stopped. What almost happened? She stood in the doorway with her hands loose at her sides. She was not good at this part. Not the receiving part. Not the part where someone looked at her with a specific quality of gratitude that had weight to it, that required something from her in return. She was better at the doing than the receiving of the acknowledgement of the doing. "You did the hard part," she said. "You survived the surgery." "I survived because you stopped." He stopped too, looked at the window. "They told me what almost happened," he said again, differently. Margaret reached over and took his hand. He looked at Mara. "Thank you," he said. The two words had nothing decorative around them, just the words. "Take care of yourself," she said. "Follow up with Dr. Reyes in 6 weeks. Don't skip it." "I won't skip it," he said. She nodded. She looked at Margaret, who was looking at her with an expression that was its own complete sentence. Then she went back to the corridor. She stood there for a moment outside his door with the ordinary sounds of the 4th floor going on around her. A television somewhere, a cart, a nurse calling something to a colleague at the far end of the station. And she thought about the specific mechanism of it, the chain of small choices and observations, and the willingness to stand in a particular place at a particular moment, and how little of it felt significant in the doing, and how significant it turned out to be. She walked back toward the stairwell. At 5:47, Catherine Marsh called. Weil had asked Mara's permission before sharing her contact with Marsh, which Mara had given, and Marsh had called 30 minutes after that. A Colorado number, the Fort Collins area code. Mara took the call in the stairwell because the stairwell was quiet and she wanted to be able to hear. "Miss Marsh," she said. "Commander Solis." The voice on the other end was measured, not flat, not suppressed, but controlled in the way of someone who had been surprised by emotion they weren't expecting and was managing it carefully. "Commander Weil told me what's happening, what started all of this." "The investigation started because of Colonel Reyes," Mara said. "I was one piece of it." "You were the piece that didn't stay down," Marsh said. A pause. "I left," Marsh said, "when it happened to me. I was angry for a long time, and then I was tired of being angry, and I built something else. I'm at a good clinic now. It's a good job." A pause. "But I thought about it for 2 years, wondered if there was something I should have done differently, something I missed, some way I could have—" She stopped. "You didn't miss anything," Mara said. "You were right about your patient, and the institution used its machinery to punish you for it. There was nothing you could have done differently that would have changed how that machinery worked." Silence. "That's—" Marsh stopped again. When she continued, her voice had changed slightly. "That's the first time anyone with any authority in any of this has said that to me." Mara stood in the stairwell with the phone and said nothing for a moment because the moment didn't need words from her. "The IG's office is going to contact you formally," she said. "Weil will be in touch about the process. Your case is part of the official record now. It's not going to be retroactively perfect. Nothing in institutional accountability ever is. But what happened to you is being documented correctly." "I know." A pause. "I know it doesn't give me back the 2 years." "No," Mara agreed. "It doesn't." Another pause. "But it's something," Marsh said. "It's something," Mara said. After she hung up, she stood in the stairwell for another 30 seconds. Just stood there, not going anywhere, not doing anything. The stairwell had the specific acoustic quality of enclosed concrete, slightly echoing, slightly cold, the sounds of the hospital above and below her arriving muffled and distant. She thought about what it cost people to be right in the wrong building. She thought about the specific courage of doing the right thing in an institution that punished you for it, without any guarantee that the punishment would ever be reviewed, without any helicopter on the way. Most of the time, there was no helicopter. Most of the time, people like Catherine Marsh were right and paid for it, and the machinery moved on without looking back. That was the thing that the past 2 days had clarified for her. Not a new understanding exactly, but an old one made sharp again, given edges. The problem was not one bad physician. The problem was the system of relationships and institutional habits that made it possible for one bad physician to operate across 2 institutions over years without consequence, because the consequences were always redirected onto the people with less structural power. Fixing that was larger than one investigation. Fixing it was, in part, what the program Webb had offered her was about. She went back to the floor. Don. Reyes was sitting up at an angle when she came back to surgical recovery at 6:30. Not fully upright. The chest tube was still in and would be for another day, and Dr. Reyes had been in twice to check the drainage, but more upright than flat, which was progress of the specific kind that felt disproportionately significant to people who had been lying horizontal for 36 hours. Vasquez was in the chair beside the bed. He stood when Mara came in. She waved him back down. "He's been trying to work," Vasquez said. "I've been reviewing documentation," Reyes said. "On what device?" Mara said. "Vasquez's phone." Vasquez looked at the ceiling. She sat in the second chair. Someone had brought a second chair, probably Vasquez, and looked at Reyes. "Webb talked to you," he said. It wasn't a question. "This morning." "And?" "I said yes." He was quiet for a moment. Something settled in his expression. Not satisfaction exactly, more the quality of a person who had placed a bet they were uncertain about and had just learned it paid. "Good," he said. "You made calls from a hospital bed," she said, "at 5:45 in the morning, after arresting." "I made 2 calls," he said. "They were necessary. Your blood pressure was 98/62, which is adequate for phone use." She looked at him. "Mara," he said, and used her name again, deliberately this time, the way he had used it the previous night. Not rank, just the name, which meant something different coming from him. "I have been watching you in civilian clothes for 2 years, and it has been wrong. The way a good instrument is wrong when it's being used for the wrong task." He paused. "You belong in a room where the stakes are real." "The stakes here were real," she said. "They were," he agreed. "Yesterday more than most days." A pause. "But you know what I mean." She did know what he meant. She was not going to tell him that she had thought about going back many times in 2 years. That there had been nights, not many, but specific ones, when something had happened on the floor that she had handled well, but that left her feeling the distance between what she was doing and what she was capable of. When the thought had surfaced clearly, and she had put it back down because the circumstances weren't right, or the mechanism wasn't there, or she was still, honestly, uncertain whether the quieter life was a choice she had made or a retreat she had disguised as a choice. She was not going to tell him that. "The program needs to include civilian nursing," she said, "not as an afterthought, as a core component." "You told Webb." "I told Webb. I'm telling you so you remember it when you're on the advisory board." "I'll remember it. And I want to consult with the staff here before I leave, formally. I want to document what I know about the gaps I've seen in the civilian-military interface and make sure it goes somewhere useful." "Also already noted," he said. Vasquez wrote it down. She looked at Vasquez, who produced a small notebook from his jacket pocket and showed her a page with her exact words on it. "When did you—" "Conference room," Vasquez said. "Farrar told me what you said to Webb. I wrote it down." She shook her head. "Commander," Vasquez said, and his voice had shifted from the dry operational register to something slightly different. Not soft, just direct in a way that had nothing to do with reporting. "For the record, what you did yesterday, coming back through that door with the box still in your car. Getting back on that floor." He paused. "I've been in the field with a lot of people. I've seen a lot of people make the call to go in when going in was hard." Another pause. "That was the call." She looked at him. She didn't deflect it this time. "Thank you, Vasquez," she said. He nodded once and went back to the notebook. She left the hospital at 7:58, not the dramatic exit of the morning before. No box, no security escort, no corridor of watching faces. Just her, in her jacket and her civilian clothes, walking through the ER entrance into the October evening. The night shift was coming on. She passed 2 nurses she recognized, a tech she'd worked with for 3 years, a physician she had covered for once during a difficult stretch, and who looked at her with the particular expression of someone who had heard the story and was still integrating it. She nodded to each of them without stopping. In the parking lot, she sat in her truck and looked at the hospital building for a moment. 6 years of her life were in that building. 6 years of shifts and critical cases and small institutional battles, and the accumulated knowledge of what it meant to care for people in a civilian emergency setting, which was different from military medicine in ways that most people on both sides of the divide didn't fully appreciate. 6 years of early arrivals and break room coffee and bulletin boards, and a patient in Bay 4 who had asked her if his back would be okay, and needed a straight answer. She had built something real here. It was not nothing. It was not enough. Both of those things were true simultaneously, and she was done trying to make them cancel each other out. She started the truck. The next 3 weeks were not simple. She had not expected them to be. The IG investigation produced findings that were released in summary form, not the full classified version, but enough for the public record to reflect what had happened. Victor Crane was removed from the board and referred for criminal investigation on charges relating to evidence tampering and abuse of fiduciary position. The criminal timeline would be long and the outcome uncertain in the way that criminal timelines always were, but the referral was real and the evidence was documented and the process was moving. The medical board's review of Preston Hale's clinical record produced a finding of professional misconduct. The specific finding was that his incident report had materially misrepresented the events of the emergency, and that the misrepresentation had been filed in a way designed to initiate disciplinary action against a colleague who had prevented patient harm. His clinical privileges were suspended pending a full hearing. The hearing would take 4 months. Mara did not know the outcome and would not for some time. She had given her own testimony to both proceedings. Not testimony exactly, but formal statements documented and signed describing the events of the morning of October 14th in her own clinical language and her own words, with the footage and the chart and Gerald Musk's surgical outcome in the record alongside it. She had also given a statement about Catherine Marsh's case, not about the specifics, she hadn't been there, she hadn't witnessed it, but about the pattern, about what it looked like, from the inside of a clinical environment, when institutional process was used systematically to silence the people whose job was to catch errors. About the cost of that silencing, not just to the individuals targeted, but to the patients who were never protected by the flags that never got raised because the flag raisers had learned what happened when they raised them. The statement was 12 pages. She did not know what would happen with it beyond the immediate proceedings. She hoped it would be useful. On the last day before she formally processed out of Crestline General, she spent 4 hours in a conference room with Diane Forsyth and 3 other senior nursing staff, going through everything she knew about the clinical gaps she had observed, where civilian nursing training missed the patterns that field medicine generated, where communication broke down between civilian staff and military personnel in medical settings, where the assumptions on each side created blind spots that cost time and sometimes cost more than time. Diane took notes. One of the other nurses, a young woman named Brianna, who had been on the floor for 18 months, and who had, on the morning of October 14th, been one of the people watching when Mara walked out, typed everything into a document that Mara reviewed and corrected and signed off on. It was not an apology, the session. It was not a resolution of everything that had happened on that corridor. It was work. Useful work, directed at a real problem, done by people who were good at their jobs and wanted to be better. That felt like the right note. At the end of it, Diane walked her to the elevator. "You're really leaving," Diane said. "I'm really leaving." For what? Mara considered how to summarize it. A program. Training. Trying to fix something I've been watching break for a long time. Diane nodded slowly. "You're going to be good at it." "I don't know that yet." "I do," Diane said. "I've been watching you work for 6 years." The elevator arrived. Mara looked at her. Diane was not a demonstrative person. She expressed things through efficiency and directness and the specific quality of attention she gave to problems she cared about. "Thank you," Mara said, "for this morning. The first one, when you listened." "You told me there was a helicopter coming," Diane said. "That's a hard thing to ignore." "Most people ignore it anyway." "Most people," Diane agreed, "haven't worked with you." The elevator closed. Quote, Colonel Darnell Reyes was discharged from Crestline General 11 days after his arrival. His discharge summary documented a right thoracic gunshot wound with shrapnel complication, surgical repair of the subclavian, bacteremia secondary to Pseudomonas aeruginosa, and 1 episode of ventricular fibrillation with successful cardioversion. Recovery was described as complicated but complete. Prognosis was excellent. The summary did not document everything. It did not document Vasquez at the foot of the bed at 5:45 in the morning. It did not document the 4 minutes of compressions or the specific quality of silence in the recovery bay when the monitor found its way back to sinus. It did not document what it cost Todd to stay past his shift or what it meant that Dr. Obi kept a paper notebook, or that Dr. Reyes had filed her clinical outcome report voluntarily at 11 in the morning because she believed the record should reflect what had actually occurred. Medical records never documented everything. That was what people were for. Reyes walked out of the hospital on his own, slowly, with a slight favoring of his right side that he would be working on in physical therapy for the next 8 weeks, and with Vasquez at a distance of exactly 3 feet, which was close enough to catch him and far enough to preserve the dignity of a man who did not want to be caught. He stopped at the entrance and stood in the Colorado morning for a moment. Mara was there. She had not planned to be. She had said her goodbyes the previous afternoon, when it was clear the discharge was coming and the timing was right and she had other places to be. But she was there, standing near the entrance in her jacket, and she had no better explanation for it than that some exits deserved a witness. He looked at her. "You're supposed to be in San Diego," he said. "I leave tomorrow." He nodded. He looked at the parking lot, the morning, the sky that had the same high-altitude clarity as it had 11 days ago when a helicopter had come out of it. "Fort Collins," he said. "The nurse. Marsh. I've been in touch with her. She'd be good for the program." "I know. I'm going to ask her." He looked at her. "You've already asked her." "She said she'd think about it." He almost smiled. It was the same almost smile as 11 days ago, the one that his face produced when it had more to give. "Good," he said. Vasquez brought the car around. Reyes turned toward it and then stopped. "Mara." He turned back. "The people in there," he gestured toward the building. "What you built here. The nurses who know more because of you. The patients." A pause. "That doesn't disappear when you leave." She looked at him. "You were not wasted here," he said, "and you won't be wasted there either." She stood with that for a moment. "Get in the car, Colonel," she said. "You have physical therapy in 2 hours." He got in the car. She watched it leave the parking lot and turn onto the main road and disappear into the ordinary traffic of a Denton morning. And then she stood there alone in front of Crestline General for a moment longer. The building looked the way it always looked. Functional, institutional. The particular beige of a structure built in the 90s that nobody had gotten around to updating. Ambulance bay on the east side. Helipad on the roof she couldn't see from here. The main entrance where 2 security officers were changing shift, and a woman was coming out with flowers she'd been given, still in the cellophane, holding them carefully. 6 years. Everything that had happened inside those walls, the patients she had found in time and the ones she hadn't, the shifts that had tested her and the ones that had been routine, the morning 11 days ago when she had carried a cardboard box out of that entrance while the hospital watched and said nothing in her defense. She had come back anyway, not because she was noble, not because she had a plan, because someone needed her, and coming back was the right thing to do. And she had always, in the end, done the right thing, regardless of what it cost her. That was not a virtue she had chosen. It was something that had been built into her through years of being in situations where the cost of doing the wrong thing was paid by someone other than herself. And she had decided a long time ago that she could not live inside that calculus. She turned and walked to her truck. Inside, the cardboard box was still on the passenger seat. She had never brought it back in. She sat in the driver's seat and looked at it. The stethoscope. The trauma shears, the annotated clinical binder, the photograph tucked inside the folder. She took the photograph out. 2 people, her and Reyes, in a location she would never name in a public document, wearing gear that told you everything about the context and nothing about the moment. He had the wide, tired smile of someone who had just done something very hard and was still processing that it had gone right. She was looking sideways at something outside the frame, which meant she had not known the photograph was being taken, which meant it was the most accurate photograph of her that existed. The face she actually had when she wasn't performing anything. She looked at it for a moment. Then she put it back in the folder and put the folder in the box and put the box on the passenger seat and started the truck. She had a program to build, not a perfect one. Not one that would fix everything or reach everyone or prevent every Catherine Marsh from having to rebuild her life around a loss that should never have happened. The problem was larger than any program, larger than one investigation, larger than what any one person could address in a career or 2 careers or a lifetime of showing up. But it was real work aimed at a real gap, and real work was what she had. She pulled out of the parking lot. Behind her, Crestline General continued doing what it had done before she arrived and would do after she was gone. Absorbing emergencies, managing crises, trying to be the institution it was supposed to be, falling short in the ways institutions fell short, doing better in the ways that people inside it chose to do better. That was how it worked. Not through dramatic reinvention, through the accumulation of small decisions made by people who could have looked away and didn't. She had been one of those people for 6 years. She was going to be one of them somewhere else now. The road opened ahead of her. She drove. There's a particular kind of strength that does not announce itself. It does not raise its voice or seek acknowledgement or require anyone's permission to exist. It shows up early and does the work and stands in the space that needs to be occupied and takes the consequences of doing so without asking to be thanked. It is the kind of strength that gets mistaken for compliance until the moment it isn't, and then everyone in the room understands what it always was. Mara Solis drove north out of Denton on the first clear morning of what was going to be a long winter, with a box of her things on the passenger seat and somewhere to be by tomorrow, and she did not look back. Not because the past wasn't worth looking at, but because the road ahead was the only thing that mattered now, and she had always known the difference.